Hello, hello, hello. And today is the 4th of April, 2022, and I am Dr. Pam, and this is our NCE Boot Camp. As we start off, I want to give you just some overall pointers. I know there are people who you work with, people you see every day, and you're like, how the heck did they pass that test? I'm smarter than them, right? I'm going to tell you their test-taking skills. So part of today is going to learn the skills as well as the content, and you have to have both. I will tell you that you cannot gloss over, right? If I ask you and I ask you who is Holland and you say Riasac, that's not going to be enough to know. You've got to know what ASCC stands for. You've got to know what it looks like in a question, right? That a mechanic would be very realistic because he's hands-on. And it's very rare that you're going to be an R and an S, right? Because they're across from each other. So that's how detailed you really have to know it. So a lot of my clients just kind of want to, kind of cover the surface, and that's just not going to get it, guys. And don't tell me that, oh, I'll know it when I see it on the test. Doesn't work that way. Okay. Just a few tips for the test, and I'm sharing with you what I share with the people that I tutor individually. I do tutor individually with my clients, and I'm giving you the same information that I give them. Don't ever change your questions. Ever, 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 ever. I've been doing this for a million years. I probably tutor about 60 clients a week. I have never, ever, ever found that to be the best choice. If you spent time on the question and it made sense at the time, leave it. Don't go back. If you have no idea, flag it, but don't answer it. Okay? Do not answer it, flag it. I don't recommend that you ever flag more than 17 to 20 because you're going to run out of time. At the end, go back and you can only look at the ones you flagged. If you finish the test in 2.5 hours, you're missing something. It's a reading test. It's a reading test. It is very doable. It is doable, but it's hard. They describe it as a power test, that you have to power through it, 4 hours powering through it. I don't know what the mask mandate is in your state, but in most states it is, well, I don't know, Michigan is not. So I'm not sure where you are with the mask mandate. I would check with your local place before you go. But if you have not sat with the mask for 4 hours and had anxiety taking a test, I do suggest you practice that first. Okay. And I know that some states have required it, have not. I'm not really sure on every state. That's something you'd have to decide with your local board. I hear all of these myths about how the test is scored. They're out to get you. If you miss one in this area, they'll give you 20 more. I'm sorry, it doesn't work that way. I've heard it's higher in career and it's higher in groups. There may be more questions about careers and there may be more questions about groups, but they all can't be in that category, right? So it can be a ethics question asked in a group style. Right? It could be a career question asked in a group setting. So understand that the content is the content of the content. It's not going to change. I'll share my screen. Okay, and we talk about, of course, the KCREF areas, but I'm looking at the major domains, and this is the NBCC handbook, so I definitely suggest that you download that and make sure that you understand about the test, even if you've taken it already. So you will see that these are where my scores are coming from. The highest percentage of scores are my area of clinical focus and my counseling skills and intervention. See that? That's where those scores are coming from. Now, if we go down and look to see where they're coming from, so under practice, policy, practice, and ethics, there's 12%. There should be around 19 questions. Can they change by 1 or 2? Yes. Okay, but not a whole lot. They've got to stay in that percentage. That's the rule. So when you look under there, you see what's under the professional practice and ethics. Okay, informed consent, referral, supervision. I always tell you, please, please, please read the code of ethics for yourself. I don't care what any other book says or what your boss says. Read them for yourself. Some of those questions are verbatim. What I hear all the time, and we discuss all the time, can we take a gift? And what I hear is no, never, never, or yes, if it's $25 and under. The code of ethics doesn't say either one of those things. The code of ethics says I'm going to take into consideration the reason for the client giving me the gift, the reason for me wanting to accept the gift, maybe there's some cultural implications, and then decide if whether or not I can accept a small gift. Okay, so it doesn't say yes or no, and it doesn't say $25 as your boss may have said, or no, we can't ever take gifts. It doesn't say that. So be sure that you read that yourself. Don't listen to someone else's version. Unless you want to listen to one of my videos because they're correct, but just make sure that you get it right. Under intake assessment and diagnosis, again, how to conduct a biopsychosocial, how to do an MSE. The MSE is your mental status exam. Okay, and so we use those, and many of those use them in your office all the time. That is not what they're supposed to be used for. Okay, that's unethical. Please don't go back and tell your boss, Dr. Pam said, I don't need any more of that. But truly, the MSE was written to find someone who's in a psychotic state or someone who's had a head injury. It's supposed to be short and brief. So if I have a car accident and I'm kind of foggy, then you use an MSE, right? If I got a client come in the emergency room and I think they're having a psychotic break, that's when I use the MSE. I know that most of you use it as documentation, right? For your, because your agency gets paid for that sheet of paper. Let's just be honest, right? So, but for the test, that is not what we use it for. Just know, and in real life, that's not what we use it for. Your agency might, but that is not what it was written for. Screen clients, select and interpret appropriate assessment instruments. Okay, so you see, this is under intake assessment and diagnosis. What? Those assessment things are under there? Like the WACE, oh my gosh, for adults, and the WIPSI, the WPPSI for kids, and the Rorschach, right? That's the black and white ink, the ink block. So that's where those are at, some of those questions. Under there would also be those career assessments, right? Knowing that the SDS, the self-directed search, that's Holland and the strong interest inventory. The career pattern study belongs to Super. The career belief inventory, that belongs to Krumboltz, right? So that's going to be under there. So know what to look for. Pre-test, post-test measures, that is the Solomon Square. You're like, oh my God, Dr. Pam, what does that mean? I'll go over it, no worries, okay? I'm just telling you the things that you need to know. Now my area clinical focus, right? That's got a whole lot of points in there. That area clinical focus, it's 29-30% of the test and at least 47 questions. And that's where a lot of people missing those questions. So I do have to know my theorists. I have to know my theorists. I have to know, according to a Gestalt, what would it look like? I have to know that when I see here and now, that belongs to Gestalt, right? Narrative therapy says I'm going to take the story out of my head, right? I'm going to externalize it. I'm going to deconstruct it, take it apart, rewrite it, and put it back in my head. And those are the terms that you need to know, because if it says in the question, which therapist believes you need to externalize your thoughts, you got to know what theorist that means. Most of my clients say, well, I know narrative therapy. That's kind of when you change your talking. Well, yeah, but that's not going to be the right answer on the test. You have to know the steps and the verbiage that client would use or that counselor would use. Okay, so as we go over, we're going to learn the verbiage. So whenever I see unconscious, right, psychoanalytic, psychodynamic, I go Freud, ding, 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 Freud, right? It may not always belong to Freud, but it's going to belong to one of my psychoanalytic people that believed in the unconscious. I know that. So if it's asking me about Glasser's reality therapy, and one of my questions is about something unconscious, I can rule it out immediately, right? That's not going to be the right answer. Again, so financial issues, grief and loss, hypo mental focus, insomnia, maladaptive eating disorders, those questions about diversity, right? They're under that same section as well. Knowing between emic and etic, right? Emic is the way that we want to see the world from the client's viewpoint. Etic is that universal view, the world view, right? We all look alike, we all sound alike, and we're all good. No, we don't want that ethic view. We want to value diversity. We want to know that you're going to see it from that different viewpoint. Again, so all of my DSM, or my disorders, my terminal illness, the code of ethics, that's a code of ethics question, right? If you have a client that wants to end his life, what do you do? The code of ethics says that you can or you can't. If you live in a state where it's legal, then you certainly can engage that client in conversation. You can support that conversation, but if your state does not support that, then again, you can always support the client self-determination. So that's a code of ethics question. And like this one depends on your state, but it's always going to be the same answer, right? Many times follow your state and legal guidelines. Okay, so it's going to give you in the question what to look for. Divorce, marital, so that's where my LGBTQI terms are going to be, gender dysphoria, things like that. Treatment planning. So now I've taken all of that assessment piece and now I have to look like what it looks like in a treatment plan. I need to know that solution focus, SFBT, right? That's the one where, that's the miracle question. 6 sessions, you wake up and the miracle happened, what would it look like? I need to know that goals need to be measurable, right? Goals and objectives have to be measurable. That may sound silly, but when I started practice way back when, as my kids will say, when the dinosaurs roamed the land and I went to that one-room schoolhouse, so the goals didn't have to be measurable. We really said, well, if the client feels better, it's okay, because he says he feels better. I also started practice before HMOs. I know, like what? Oh my gosh. I'm trained psychoanalyst, right? I'm trained in hypnotherapy. You could lay on my couch for 3 years and pay me and no one ever ask a question. Those were the days. Now with HMOs, right? You have to justify why you need those 12 weeks and they have to be written in specific goals. So that's what it looks for, because we want you to know that it's not like it used to be. Okay. I'm just telling you, those were the great days. I only got about a year or two with that. And then of course HMOs came in. But even like, the state dollars, the Medicaid dollars, they didn't ask. They didn't ask. Like, okay, yeah, he's depressed. And I had to send in notes occasionally, but they weren't measurable. They weren't specific. I didn't learn that in college because that wasn't a thing. So knowing now that they have to be measurable, and if you take state Medicaid, if your agency bills, you know how detailed those notes have to be. You know what it has to look like in order to get paid. Or if not, your boss will come back and say, hey, we need that money back. So. And then, sorry, my counseling skills, that's another very big part of that, right? So if we go back, I think that's the other counseling skills, 30%, again, about 50 questions, So looking at those. Okay, so again, now I have to align my intervention with the counseling modality. Those are the questions that say, you're a therapist and you've got a group of 12 alcohol and drug addicts. You can choose any theory you want. Which one would you choose? Right? I don't know, I have no idea, right? So we have to know the theorist well enough to know which one it would apply. I can tell you, I'm not going to use a client-centered, person-centered. That's not what we need with our drug and alcohol users. I'm sorry. And if you have a person who tells you that and you get paid for that, go ahead. And it's not the right answer for the test. And that's really not the best thing, right? So Carl Rogers, client-centered, the client is the expert. As long as I am warm and congruent and genuine, right? My mouth and my body line up, the client can fix themselves. I am pretty sure most drug and alcohol users don't fix themselves. Just saying, I know there's one or two, but for the test, that's not going to be the right answer. So I have to know enough about the theorist to know how it works, then to decide what I'm going to use for this population. So that's again why we have to know those theorists. Address addiction issues. Oh, speaking of addiction issues, most often that's going to talk about the pre-contemplation, right? The pre-contemplation, it's called the trans-theoretical model. Pre-contemplation, contemplation, plan, act, maintain, probably not, go back and plan again. So knowing the stages and knowing that MI comes in right there at that contemplation stage, right? Because the clients are ambivalent. Okay, and on and on and on. Our core counseling attributes. Congruence. Congruence always means that my body and my mouth line up. What is coming out of my mouth matches my body. It lines up. That's what congruence means. You might also see congruence with trait and factor, right? Because Holland said if you know yourself and know about the job, those would match. That's congruence. Okay. So if a client is incongruent, then it's okay to confront them. If they've given me two different statements, right? Or their body and their mouth are saying two different things. You know what? I tell you, I'm fine. Okay. If your spouse says it that way, they're lying to you. Just if you don't know that, it has to match up. Okay. And truth, if in the real world, if it doesn't match up, you believe the body, not the mouth. The mouth can lie, the body can't. Okay. Reflection. Reflection is one of those listening skills. Reflection always uses feelings. My response to the client uses feelings, right? So I'm many times using the feelings he didn't say, but that's where that comes from. Those are those attributes. Okay. And then of course, these other, all that are covered in there, assessment and testing, research and program, group counseling, those are all then embedded in all of these other areas. So that's what the test looks like. Okay. If you're taking the test at home and you don't get to choose that, many states allow you to take it home. And if that's you've been allowed that, let me just give you a couple of things. You can only take the test at home once. Okay, so if you don't pass, if something happens, an error, a glitch online, you don't get that option again. That you have to take your camera, take your, show it around the room, make sure that there's, they're showing and looking at everything. You have to hold up your ID and you have to put your face in, everything has to match. If you move your lips, even if you're talking out loud, they will ding you because they may think you're talking to somebody else. So they will ding you. Okay. If you're staring at something too long, and I'm a thinker, like, they'll ding you. Okay. Because they'll think you have something written on the wall or you're looking at something. I believe you get a 15-minute break and they tell you when you take the break. If you're late, you take 16.5 minutes, dang, right? You get one warning, and then after that, they're going to stop the test. So just know, and again, for a lot of my clients, that reduces their anxiety by like so much. It does. But those little things make a difference. I want to make sure that you know that, okay? Anybody in here taking it for the very, very first time, just give me a show of hands. I see some people in the same hands. Okay, so let's see here. Someone who's taken it more than twice, say something for me. Oh, come on. I know some of you have.
I have.
Okay, Sheila, or Shrika, I'm sorry.
Yes.
Okay, Sharika, so for the people who haven't taken it before, can you share with them what the process is like even before you sit down? Because if you don't know that, that is anxiety provoking. So give us a little idea what that's like.
Yes. I have really bad anxiety. So at our testing facility, to me, it kind of felt like just going into a prison because they pat you down and you have to show them your jacket. If you have on a jacket, you have to put your phone in the locker. If you wear glasses, you have to put them down on some kind of thing and they will look at it, I guess, to see if you have a camera on it, something like that. You have to turn around, show your pockets, empty your pockets, stuff like that. So big process.
And you never get patted down by the attractive person of the other sex. I'm just saying.
Correct. Mhm.
I've said, can he do it? You never let that happen. But I just want to give you a heads up so you know, because I think a lot of people who don't know that and you're already anxious, that makes it so much worse. So as much information as you can have going in, that's going to decrease your anxiety. Okay. Thank you very much for sharing. Anyone that's taken it want to add anything else to that?
The fingerprint and the handprint. They fingerprint you and they do the
The
palm
palm?
print,
Yeah.
and they do it multiple times. So for me, that was something that caused a great level of anxiety because I kept wondering, like, why are you doing this multiple times? And even, with them checking your pockets, they make you do your belt as well. Like they'll make you swipe around your waist to make sure you don't have anything, and even they'll make you rub down your pants leg. And for some of them, pull your pants leg up or take your shoe off as well.
Thank you very much. Thank you. I just think for a lot of my clients, having that information makes a huge difference of going in that room. Um, so what was I going to say? Okay. Also, so if you have taken it more than twice and you really, really, really have given it your all and you haven't passed, I would recommend that you apply for accommodations. Okay. So the ADA doesn't recognize mental health difficulties any different than it does physical health difficulties. Okay. There's a couple of states that won't do I know New York and maybe Colorado, Utah, that won't do the language accommodation. So if English is not your native tongue, if you were in ESOL classes, if you came to the United States and you can prove when you had it, then you can ask for the accommodations. They'll let you bring your own dictionary. And for a lot of my clients, they'll say, I don't need it. It's not the clinical words. It's not the clinical words. It's the everyday, the verbiage that's in there. They're like, what the heck does that mean, right? So those are the words that I suggest that you use it for. So take advantage of that. Anxiety. If you have anxiety and it's kicking your butt, you cannot pass this test with your anxiety this high. That is just not possible. It's called the Yerkes-Dodson theory, and it was written about athletes that when you're here, right, a little bit of anxiety is good. That gets you up and that gets you fired and ready to go. Anxiety up to here is debilitating. You cannot. When my anxiety is up to here, I can't find my bank card. I can't find my car keys. I forget where I'm going. How the heck can you do a major task like this if your anxiety is kicking your butt? Okay. So when you apply for the test, or if you decide to go back and add accommodations, if you add them when you do your test, there's no extra charge for that when you sign up for your test. If you add them later, it's $35 and it will push your test back, way back, way back, way back. Okay. A couple of things that I usually recommend. I'm going to recommend 2 extra hours in a private room. That's pretty standard. So if you have ADHD type symptoms, you don't have to have ADHD. You don't have to be medicated. If your doctor or mental health provider will put on a form that you have those type of symptoms and you need extra time in a private room, then they will honor that. Be very specific about the time though. If they just say extra time, they'll decide how much time you need. Okay, so be very specific. Again, your mental health provider or your physical health provider, it doesn't matter. Either one is the same. If anxiety is kicking your butt, do something about it. Okay, honestly, just do something about it. We know as therapists, as clinicians, we know that anxiety just didn't happen for that test, right? You've had some anxiety to begin with. You've had it. We've all had it, right? And then that test comes and I go, whew, right? Okay. They make medication for that. Just saying, right? Okay, so ask your doctors. Ask your doctor if you're in a medical marijuana state. A lot of my students do that, a medical card. I've heard CBT, sublingual, things like that. There's a medication that lowers your blood pressure that a lot of my students take, and it's again, that's one you take like the day of the test. Of course, the Xanax and the Valiums. A lot of doctors will recommend that. They're only going to give you like 4 or 5. You are not going to get addicted. Oh my God, you're not going to get addicted, okay? But don't do that the first day of the test, okay? Try it before. You need to have practice sitting down 4 hours taking a test with that medication before you actually do it the day of the test, okay? So just practice it. But it's no one will know that you got accommodations, okay? It's not going to be, oh my gosh, she passed, but, right? Think of all the doctors, the lawyers, the people you see that are licensure. And I'm going to be honest, I've gone to my doctor sometimes, a doctor that I didn't understand what they were saying, that their English was not very clear. They had to pass that test in English. They've had accommodations. It's not embarrassing. It's not a bad thing. That's what it's for. Okay, so please, please take advantage of that. I mean, I also recommend that with your clients and your own children. My children had accommodations for the SAT and the ACT, right? Any of those exams, even in college. My youngest one has, she has a program in college. She's got major anxiety, and sitting in a classroom with 80 people taking a regular test freaks her out. So she gets a private time and a private space to take her test. So please don't, and we of all people, do not let mental illness, or I'm sorry, I won't say mental illness, I'll say mental illness, behavioral issues. Don't let don't do like other people do and think it's not real, or there's something really wrong with me if I need accommodations. If you were diabetic, if you had a broken leg, you wouldn't give it a second thought. Okay, so please, please, please don't let that go by without at least taking a look at that. Okay. What if you're too confident in passing? Like you're just like, I know what I'm doing. I know this. Yes. Okay. Yes, you can go back in accommodations. Yes, you can go back and request accommodations afterwards. It will push your test back at least 6 to 8 weeks. Just so you know that. It didn't used to take that long, but with COVID, it does take that long. What if you know what you're doing? They're not. So if you are doing at home, you cannot have accommodations. That is correct. You cannot have them at home. Okay. If you know what you're doing. So, Kiara, if we finish today and you know exactly all these questions and you're done, then you're good, girl. Okay. Okie dokie. So I'm going to go into, I think I covered everything about the tests. Let me go. Did I cover they're not trying to trick you? Okay. So there's not evil people out there that write test questions. They are you in a few years. Every so often, they'll put out a search for people to come in and write questions, right? They'll put out a search. You get paid for it. So you have to be licensed and have experience, but they'll just put out this thing saying, hey, come and write test questions. They train you how to do it and they pay you. Those are the people that write the questions. They're not some evil people that are out to get you. I promise you. As I said to you before, the test has to be in those certain numbers. It cannot be higher in this and higher in that. So it may seem like it is, but it has to match that equation. Okay? So they're not trying to get you. It doesn't change in the middle of the test. If I miss 3 research questions, they're going to give me 10 more. All of those things are not true. Your test is not based on the people that took the score that day. I've heard that one as well. Every state has the right to set its own passing score. I think I said that earlier. There are 2 versions of the test, a higher and a lower. The way the test is set is usually based on the last 90 days in your state. So if they're giving a version of the test and everybody is getting like 120 on that test, they're going to raise the score. Right? Because that test is too easy. They're going to raise the passing score. If in that last 90 days, the version they're giving everybody fails awful, they're going to lower the score. Okay? So you got last time I went in, I got an 86 and that was passing. And this time I got a 91 and that's passing. Yeah. The version of the test and what the average looks like in your state. Absolutely. But they're not out to get you. If you call them, there's no trick formula. What I'll tell you again, I think I said before, when you're doing practice tests, you need to be scoring in the high 70s, low 80s to know that you know the stuff. Okay, other questions? Okay, go ahead.
Sorry. This is my second time first time I did it on at home,
Mm-hmm.
and the guy, what forget the name, he was interrupting me like all the time, asking me dumb things like, "Are you okay with the test? Do you have any questions?" I didn't know that was not correct, so I didn't fight for it at the time.
Mm-hmm.
Turn off my computer, and if you guys gonna do it online, make sure that your computer is already plugged in, because I leaned forward to pour the computer, and the guy was like, "What is in there? Let me see. I'm plugging the computer. It's gonna die. Let me see that." So
Mm-hmm.
make sure that your computer is plugged in, and if they are interrupting you, because when I fought for it, it was too late. It was like 8 days after, because I didn't know. And make sure that if that happens, you tell them and let them know immediately after the test.
I'm going to say that about everything in the test. So in the testing center, I've had people complain that there were like people like the staff like eating lunch right beside them and making lots of noise, and being other people being rude and disruptive. If anything happens, you need to report that within 24 hours, both to Pearson as well as the NBCC. Okay, within 24 hours, because definitely that's not okay. Standardized testing means we all get the same test under the same environment. That is not okay. So be sure that you report that, okay, and within 24 hours. And many times what will happen is they'll let you take it the next time. They won't count that at all. Let's take it the next time, because they'll just invalidate that test. Okay. Okay.
I have a question
hold on.
about talking. Sorry.
Okay. Go ahead.
Okay, so when I took my practice test online at home, I started reading a question out loud because that does help me when I hear myself read it.
Mhm.
And I got pinged, and the guy was not nice and just doing his job, but that skyrocketed my anxiety for the rest of the test.
Mhm.
So is that an accommodation reading it out loud, or can I go to the testing center and be able to mouth and whisper it to myself?
You're not supposed to be able to. That's one of the reasons I suggest a private room, because if you're an
Okay.
auditory processor and you need to hear yourself, you can't do that in the room.
Okay.
Okay.
Thanks.
So yes, most definitely. Okay. Kiara, you said you took a 92 on your practice test. It depends on what tests you took, to determine the validity of it. So do you know what test you took, or do you want to put it in the chat box? I'll tell you if you took and not just you, anybody.
I'm sorry, I took the Hellwig.
If you took the Hellwig and you made 92, you are great. You are great. That's the closest practice test you'll get to the actual test. Good. Earplugs. They offer you earplugs. That's my understanding. So they do offer you some if there are people that are around you or you ask for them. Excuse me. Yes, you'll get a practice test today. Excuse me. You'll get all the material that I'm using. Okay, so I'm going to get started, guys. And what I'm going to do first is, excuse me, I'm going to just look at how we answer the questions, okay? Because that's a big part of it. Sometimes we get there and there's like that one line and we're thinking, oh my gosh, what do we do? So I'm going to mute you all. If you'll kind of hold yourself, I probably will call on you in just a minute. But in general, just mute yourself. I want to just kind of go through a question or a couple of questions and talk about how we answer them. Okay, I'm going to share my screen. Okay, I am using Pocket Prep. I'm using the marriage and family version because many of the questions are well, the content is the same. The questions are written differently. And please don't answer, don't answer, don't answer, don't answer. And also, if you are sitting with me, if you turn your cameras on, I know if you don't understand. I can tell just by the look on your face, and I'll explain it more without you ever having to ask again. So I always suggest that you turn your cameras on. I think it's beneficial for you because I can tell if you don't understand. I am a therapist. I can read that body language. A prospective young adult meets with you for an intake session. At the end of the session, she asks you if she can bill her insurance instead of paying your typical fee. She reports that she saw on your website that you accept her insurance on your practice website. How should you respond next? The first thing I'm going to do is make sure I really understand the question, because sometimes I have no idea. And do not look at the answers until you understand the question. Okay, that's really important. So I've got this young lady. She comes in. She meets for an intake session. At the end, she asks me if I can just bill her insurance instead of paying my typical fee. Right. So she says that you saw on your website that you accept her insurance. What should you do next? A, you should discuss the pros and cons of using insurance to pay for therapy. B, you should request a copy of her insurance card in order to determine her policy's provisions and exceptions. C, you should explore her hesitation about paying your typical fee. Or D, you should determine whether she will save money using her insurance before submitting the claim. Okay, so I'm always going to rule out 2. Most often and the test is written that I can rule out 2 and I can keep 2 in. That's written that way, and then I'm going to compare the 2. So if you think I get down too easy, you're supposed to. Okay. So then I'm guessing, and I always think about what are they trying to measure? Which of those KSAs are they trying to measure? I'm thinking this is probably code of ethics, or making sure that I'm making an ethical choice, right? My ethical principles. So then, what should I do next? Okay, let's see here. Lisa, what would you rule out? Lisa Beach, what would you rule out?
I would rule out A.
Okay, you should discuss the pros and cons of using insurance to pay for therapy. Okay, anybody else? What else would you rule out?
D.
You'd rule out D. So now we're down to B and C. Okay, if I'm down to those 2, then I'm going to compare the 2 to each other, see how they're different, and go back to the question and make sure it answers my question. So I should request a copy of her insurance card in order to determine her policy's provision and exceptions, or I should explore her hesitation about it. But answer my chat box, guys. What do you think the answer is? Put it in the chat box. I see A, B, 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 B. The answer is B. There you go. There you go. Okay. And someone tell me why. Let's see here. Who answered B? Jessica. Jessica with little cute ponytails. Or a hairband, maybe. Glasses? That's you, okay? So, did you pick B?
I didn't put an answer in, and
Okay, well then,
So, I don't know.
why do you think B is the correct answer?
I mean, the only way you can really kind of know what her coverage is and know what to let her know to expect is by verifying the benefits.
Absolutely, absolutely. Another reason it's correct is because she says that it's on my website, right? I have to, that code of justice, I'm sorry, the code of ethics, fidelity, veracity, faithful and true. If that's what it says, I have to keep my word, right? Because it says it on my website. I should have probably discussed it with her before, but now that I didn't, that makes that the best answer. Okay, and if you want to see the rationale. Okay, and again, code of ethics, code of ethics. Okay.
That's a good example to me of putting my own stuff in it because I work in health insurance and I think about how many doctors don't have accurate information on their website. But it makes sense, like, code of ethics.
There you go.
Doesn't have anything like that. So.
There you go. There you go. Okay. So, and again, so thank you for bringing that up. Remember not to bring your job into this. It has, unless it says, according to the place you work and your first and last name, it's not about you, okay? So that's why I'm gonna say, keep it in the question. And I'll ask you, how do you know? As we're going through, I want to know how you got it, rather than if you got it right, because that will teach you how to answer the questions, not, oh, I got it right. Okay, so all of the following are true when it comes to modifying treatment plans with the clients except. I hate these except questions, and on the test, that except is not big. One of the keys I'll tell you is when I'm reading the bottom and all of those sound really, really alike, I'm like, okay, I missed something in the question. Let's go back. When I see the accept questions, what I'm going to do is I'm going to really think of 3 of these are true, 1 is not. So in my mind, I read it like 3 of these are true, 1 is not. Okay. A, you should routinely assess goals and progress toward achieving goals. B, you should discuss treatment planning during your informed consent process. C, you should always ensure treatment plans are in compliance with the client's insurance authorization. D, it's a good idea to collaborate with the client regularly to review the process. Let's see here. Brandy Boone, you want to be brave with me? I haven't bitten anyone this week. You're muted. Unmute yourself.
I'm going to guess.
Hold on. I don't want you to guess yet. Okay, so first of all, and we don't guess, by the way. We know the answers. we don't guess. Okay, so first of all, let's always rule out, even if you know the answer or you think you know the answer, read all the questions and rule out, follow the same process, okay? So what can it not be?
A.
A, okay, because yes, I should routinely assess the goals, right? That's true, okay. So then what else?
I think it's always important to collaborate with your clients
Okay.
regularly.
Okay. So modifying the treatment plans, I'm going to keep A and B in. Those 2 things match. Now I'm down to C or D. When I get down to C or D, I'm going to compare the 2 to each other, see how they're different. Okay. And even if you know the answer, guys, go through the same process, because many clients miss the questions because they just didn't read. They went through it quickly and just didn't read. I'm going to go back and mute everybody, guys. So you can, again, unmute yourself to talk. Okay. So then, Brandy, you can unmute yourself. Okay. So what is your answer between B and D? Or C and D, I'm sorry.
I'm going to guess C.
You should always ensure treatment plans are in compliance with the client's insurance authorization. Yes! Yay! Okay. Real world, is that true? We all know we ain't gonna get paid unless it matches. But the test does not ask you that. This test has nothing to do with the real world of whether you get paid for it, right? It's always about the client. When you got up this morning and put on your pants, why did you do that? Because the client needed me to. Why do we have a code of ethics? Why do we do anything? It's always about the client. If the answer says anything because it was good for the therapist, that is not the right answer. We don't care. It's always about the client. Okay? Good job. Good job on that one. Anybody struggle with that? Yes, you did, because I can see the look on your face. We'll keep going. This is a simple recall question, okay? And it looks really simple, but it's very, very wordy. When I see them being this wordy, it freaks me out. I'm ADHD, and all I see is those words blur together, and I'm like, oh my gosh, what is this? So which of the following is a key difference between schizophreniform disorder and schizophrenia? So anybody volunteer who knows the difference? Don't answer the question. Just tell me what the difference is. Tarsha, is your hand raised? Is it Tarshia?
It's Tarshay, but that was from earlier.
Was Tarsha, since you're here, nice to meet you. Let's just go ahead and work this out, okay? Tarshia. Okay. Do you know the difference?
I remember hearing a difference, but I think one is longer than the other, the symptoms.
That is true. That is true. So this is one of the diagnoses that's almost always on there, and you do have to know this. So brief psychotic disorder is from 3 days to 1 month. Okay? Exact same symptoms. In your agency, someone comes in, you may diagnose them with schizophrenia. For the real world, that is not right. Okay, I'm sorry, the real world, still not right, but the test, that's not right. So most often what happens is schizophrenia occurs between the ages of 17 and 35. We're not really sure what causes it. We think some kind of hormonal trigger as people get older. Sometimes there's a history in the family, sometimes there's not. We don't really know. Brief psychotic. So, you get a call from the college and says, hey, little Mary Sue is dancing naked in the fountain, telling her that the devils are making her do it. Right? You go pick up your kid. We're really, really praying it stops, right? Oh, won't let it be. Now it goes to a month. Same exact symptoms. So 1 month to 6 months is schizophrenia form. It is a form of schizophrenia. Okay? Exact same symptoms, schizophrenia form. After 6 months, it becomes schizophrenia. So it has to have the symptoms for at least 6 months. And the question is going to tell you that time frame. You have to know those time frames. Okay, so that's exactly what it's going to, and again, it might not be this wordy, but you do have to know that diagnosis. Schizoaffective disorder is a combination of schizophrenia and bipolar 1. Okay, so schizoaffective, remember AFF, affective, always means mood. It's the look on your face, it's the mood. So if I have schizoaffective disorder, I have the hallucinations, the delusions, as well as the mood disorder. But I only have to have those for 2 weeks. Okay, 2 weeks of that, of both of those together. Schizoaffective disorder or schizoaffective disorder. Okay, so with that diagnosis, I can heavily duty medicate someone, right? I can give you both a lithium for the bipolar part, and I can also then give you a antipsychotic, most often like a Thorazine, a Haldol, Zyprexa. Those kind of things are what we're going to use to treat schizophrenia. While we're here, let's go ahead and look at my bipolar 1 and bipolar 2, making sure that you understand the difference between those. So hypo, H-Y-P-O, always means less. Okay, so major depression, right? So it's always going to be 2 weeks. 2 weeks is always major depression. Can't get out of bed, want to kill myself, having suicidal thoughts. All of those things belong to bipolar 2. I'm sorry, belong to depression. So now what the question may say is Pam comes in, she's being very sad and lonely and thoughts of suicide for about 2 weeks. We put Pam on a medicine and an antidepressant, and suddenly her mood rises. And it keeps rising. She can't sleep. She's irritable. She is talkative, those type of words. If I have 5 full days of that, I don't need sleep. I'm like off the chain, right? Sleeping with everybody, like, oh yeah, look at me. That's bipolar 1. 2 weeks of that major depression all the way up, 5 to 7 days, right? That's bipolar 1. Okay. My hypomania, that is less than 4 weeks. H-Y-P-O means, I'm sorry, 4 days. H-Y-P-O means less. Hyperactivity, H-Y-P-E-R, hypo, okay? So hypomanic. In a hypomanic stage, it's less than 4 days, and you might not even notice. Have you noticed every once in a while Pam's in a really good mood, right? Look at her, but not enough to like, wow, something's wrong with her, okay? So if you've ever worked with someone in a full-blown manic stage, it's interesting. So I want to say it's cool, but when I say something like that on YouTube, then people like give me dirty notes, and because I shouldn't say it's cool. But what I do think is I'm very interested in the way that our brain works. It did just, and how mental health works. It's very interesting to me. So I don't think it's cool that people have bipolar. I do think the way the brain works is very interesting. So if someone in a hypomanic stage, they're going to say, hi, I'm Pam Turner. How you doing? You want to go out and have a drink with me? Let's go and have fun. Oh my gosh, this is going to be so amazing. What dress are you wearing? I like that dress. Oh my gosh. That's like one breath. Like, whoa, okay, like what happened to you? That is also called pressured speech. So, okay, but that's what you're going to see in that stage. Again, I can do anything. I will sleep with people I would never dream of sleeping with, spend money that I don't have. You think you're Wonder Woman or Superman. Now, cyclothymia is it doesn't meet the criteria for bipolar 1 or bipolar 2. Cyclothymia is going to then be more highs, but not high enough to meet bipolar 2, right? Not high enough. So cyclothymia is 2 years in adults, 1 year in children, but it doesn't meet the criteria. Okay. Now that term PDD, persistent depressive disorder, that used to be called dysthymia, right? So dysthymia so now it's called dysthymia. So then it is the opposite. It is you have more downs than you have ups. That picture, okay? So people with PDD, life is always hard, okay? Same diagnosis for cyclothymia though, right? 2 years in adults, 1 year in children. You'll know in the question because one has more downs and one has more ups. Okay, so PDD, and if you're studying old material, it used to say dysthymia, right? So we know that both of those are the same. Okay. I'm going to stick here for a moment. So any of you, tell me other diagnoses that you've seen or you want to know more about while I'm still here.
Personality disorders like narcissistic disorder.
Love those. Okay, so personality disorders are ingrained. We have had those since birth. They are egosyntonic. That means that they're not coming for treatment. They're in sync with your ego. Remember we talk about Freud, and Freud is my id, my pleasure principle. Oh, that's my devil. And my superego is my angel, right? I'm born with my id. It wants to eat, sleep, and have sex all the time. Freud said that's what we need that for society to go on, right? Sometimes my id wins, not gonna lie. Right? Superego says no, Pam, never, 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 never. Ego is me, right? That's the reality. The ego is keeping down the id and keeping down the superego, so ego is me. That's where ego defense mechanisms come from, okay? That's what that's called. So ego is me. So egosyntonic means it's in sync with my ego. So I am not coming for treatment. There's nothing wrong with me. Ego dystonic, it's ego dy, ego dystonic. I don't like dys, so I'm not coming for treatment. Okay, so that's ego dystonic. So then the personality clusters, I've taught them back and forth. So I used to always teach them in clusters because that's the way they were written. And then for a couple of years, we didn't teach them in clusters. And now I hear on the test they're back in clusters. So I teach them back in clusters. So there are 3 clusters, A, B, and C. Remember, these people are not coming for treatment. They do not have a problem. So then my paranoid personality disorder, they are jealous. They're jealous. They think their spouse is sleeping with the milkman, the paper boy, the butcher, everybody. They think someone is trying to put something in there. They're trying to change the program of their computer. But again, not enough they've always been that way. So people may think they're weird, but he's always been a little that way, but not coming for treatment. The other ones in that category are schizoid and schizotypical. So neither one of these have the psychosis. No hallucinations, no delusions. Okay, so hallucinations outside of my head, all 5 of my senses can hallucinate, right? I can have gustatory, can you taste the poison? taste the poison, right? I can smell the poison. I smell like dead skin rotting. I smell it. I smell it. Hearing, and then tactile. I can feel things crawling on me. So all 5 of my senses can hallucinate. Delusions are thoughts in my head, right? Those are my thoughts. And either one of those, you don't ever correct anyone in their delusion. You just kind of, you don't agree with it, but don't correct them. If you've seen any of my old videos, you know that I do have a delusion. I suffer from erotomania. I do believe that someone famous is in love with me. Okay. Erotomania is when you believe someone famous is in love with you. And Barack Obama is in love with me. Don't you dare talk me out of my delusion. Don't you dare, because you can't do that. That's my delusion. I'm living in it. Okay. So those are delusions. Delusions are thoughts. So what you'll see on the test is it'll say something about thoughts. So thoughts and hallucinations, then I'll ask my clients, are the voices coming from outside your head or inside your head? Inside are delusions, outside are hallucinations. So my schizoids and schizotypals don't have either one of those. The schizoids, so they've been this way their entire life. So if you look back in elementary school and middle school, probably in your neighborhood, you probably can recall someone who was a little weird, a little different, right? So the schizoids love COVID, absolutely love COVID. They don't like anybody, don't want to talk to anybody, not even their fish. You probably have someone in your neighborhood that everybody knows don't go to their house. The grass is grown up. He comes in at night and he parks in the garage. He has the groceries delivered. You know he's home, and you'll knock on the door and he's never going to answer, right? The weird guy in the neighborhood. So that's schizoid, personality disorder. They don't have a problem. They've always been that way. Schizotypal, they're a little bit different. Again, none of the hallucinations or delusions. The difference in what you'll see is eccentric dress and odd speech. Okay, so they will talk to you, but you will be sorry that they did. Okay, so and just because it's bizarre, it's got always put toast in your pockets. Okay. I treated a client one time, and I'm from South Florida, and he wore a hat with the winter earmuffs like all the time, right? Because he didn't want like his voices to get out or his thoughts to get out and someone take them. Okay, but not delusional. Not delusional, just different. So schizotypals, you'll notice them by their dress. And again, I only teach to the test. So what you'll look for on the test questions is, their dress very odd. Okay, so those are my schizoids and my schizotypals. So, and then my category 2, my cluster B, close some windows. Okay, so if no one's told you this, I'm going to tell you this so you're really, really sure. Antisocial does not mean asocial. Asocial are people that don't like people. Okay, so asocial are people who just would rather be alone. Antisocials do like people. They'll invite you to their house and then they'll kill you and eat you. Okay, sociopaths, antisocials are people who are anti-society rules. All of our Jeffrey Dahmer, our who else? Any of those serial killers, right? Ted Bundy. Ted Bundy was the guy in Florida, and he was handsome, and he'd invite the girls over to go to help him find his puppy. And right, he was so nice and kind until he killed them, right? So just know the next time you hear someone say you're antisocial, they're not killers. Remind them they're asocial, not antisocial. Antisocial is one of the personality disorders we can diagnose as young as 16. So conduct disorder, the kids who are stealing and lying and setting the cat's tail on fire, those are conduct disorders. We diagnose them from 6 to 16. Okay. Untreated, a conduct disorder as an adult becomes an antisocial personality disorder. Again, if you've ever seen any of the interviews of the serial killers, no remorse, no empathy. They really don't get what they did has hurt somebody. Okay, with conduct disorder kids, the goal of treating them is to help them understand that hurts the cat when you do that, right? Develop some empathy. Now, my borderlines, those are next. Also, I can diagnose them at 16. My borderlines are very hot and cold. I love you, love you, love you, hate you, hate you, hate you. That the defense mechanism splitting, that many times is what you'll see with my borderlines. They love you now, they hate you later. They're black and white, very cold. That is the only personality disorder that does have a treatment, and it's relatively new. That is DBT. That is by Marsha Linehan. And that is the only diagnosis that we have that's the only treatment we have for any of the personality disorders. Because again, remember, they're not coming to treatment, they don't have a problem. So those are the 4 tenets of DBT. Marsha Linehan, dialectic behavioral therapy. She teaches mindfulness, teaches you to regulate your emotions, right? Distress tolerance. We know that many of our borderlines, right, when things get tough, when you're treating them in therapy and it gets hard, they leave. So teaching distress tolerance. Interpersonal effectiveness. INTER means with other people. Okay, so intercourse takes 2 people, INTER. An interpersonal relationship is with other people. INTRA is just me. So Freud uses intra-psychic, right, to look inside of me. If you have a group that you're working with, multidisciplinary group, and INTER, mean the exact same thing. Intra, INTRA, means you're all the same discipline. Okay, so just think terms that'll help you when you're going to test. You'll see those terms. Just remember, intercourse, 2 people. Okay. So my histrionics and my narcissists. So most often and almost always in the test, my narcissists are going to be men. My histrionics are going to be female. In the real world, they're not that way. That is not true at all. My histrionics, they are not promiscuous. They do like your attention, and they do have a very sultry voice. And I always say Jessica Rabbit. If you're not old enough to know who Jessica Rabbit was, I'll show you a picture. It's Who Framed Roger Rabbit. It's a million years ago, I know. But Jessica Rabbit. Oh, Roger, can I get a glass of water, please? Right? Those are my drama queens. So it's about me, about me, about me. A test question might be like, she's very upset that her boss wouldn't accept her friend request. Oh my gosh, does he know who I am? Like, I'm me. They're the ones that are going to walk into the party and dress to the nines, right? The high heels, the very tight dress, the bodice hanging out, and going to McDonald's, right? Okay, so I always say to my female friends, my females, if you don't know who the histrionic is in your friend group, it might be you, right? Because we got one of those in our group usually. So for the test, they're the attention seekers, right? Look at me, look at me, look at me. But they're not promiscuous. If it talks about promiscuity, sleeping around, those are borderlines. Those are not my histrionics. My narcissists for the test, again, those are men. The narcissists are, look at me, you lucky person, you get to breathe the same air that I breathe. Right? A question might say that he's telling he's bragging about all the wonderful things he's done and how he's taken his wife places and they've done this and met famous people, and she doesn't appreciate it. She doesn't care, right? So those are my narcissists. So what you'll see in the question is, A, they have low self-esteem. Okay, you'll see that they have low self-esteem, and also then they are they're not attention seeking, but they are they think they're better than others. They think that again, lucky me, I'm so great. Okay, but they're not drawing attention to themselves like histrionics would. They just know they're great. They walk into the room and here I am, right? Bow at my knees, you lucky people. But for the test, not in the real world, for the test, you're going to see them both be, histrionics are going to be females, and my narcissists are going to be men. Get rid of my Jessica Rabbit. Okay. My last ones, my avoidant people, they do like people. They do. They just avoid people because they're afraid of being judged. So the question might say something about that she has been in a relationship. I mean, she grew up in a home where she was felt very judged all the time. So definitely they feel like they've been judged. That's what they're afraid of. Dependent personality disorders, those are my adults who are afraid to make their own decision. That's my 50-year-old man who still lives with his mom, and not because his mom needs him, but he's just never been he felt like he wasn't capable of making his own decisions, right? So he still lives with mom. And the last one, my OCD and OCPD. There is a difference, and many people don't know that. My OCPD, that's the personality disorder. Those are people that are not coming for treatment. OCPD, I bet out of I think there's 70, 69 people in this room, I would bet there's at least 20 of you that are OCPD. You strive for perfection. If I come to your house and all of they go to your refrigerator and everything's lined up nice and it's dated and it's pretty, I open your cabinets and the spices are in alphabetical order, right? They're like beautiful. Oh my gosh, if someone moves it, I go to your closet and the pink shirts are lined up and the shoes are perfect. You're OCPD, okay? Just so you know, and you don't see a problem. The people around you see a problem. You just think, why can't everybody just be perfect like me? I don't understand. Okay, so at least 20. I'm not going to ask for any names, but I know. On the test, again, egocentric, not coming for treatment, don't see your problem. My OCPD, what they want is things to be perfect. So the question will say, the OCPD people will turn assignment in late, so it's perfect. Okay, again, don't have a problem, not coming for that. Their motivation only comes from the STEM to be seen as perfect. Now, OCD, my blue category, those are people that will come for treatment. OCD is an anxiety disorder. Hoarding and trichotillomania, pulling out your hair, right? Excoriation, picking your skin. All of those are anxiety disorders. So we would treat them, right, with an anti-anxiety medication or probably a Prozac, SSRI. So the OCD people, they have obsessions or thoughts, okay? Obsessions over and over and over again. I can't get these thoughts out of my head. And the compulsions reduce the obsessions. So, with COVID, oh my gosh, there's germs on my hands, there's germs on my hands, there's germs on my hands, I'm going to kill somebody, there's germs on my hands. Those are the obsessions, the thoughts. Then the compulsions, I've got to wash, I've got to wash, I've got to wash, oh my gosh. So their hands are raw and rough, and I mean, just, falling apart because of all the washing they've done. They don't like it. They can't leave the house if they don't follow their routine, right? They'll go back home and make sure that they obsess that they didn't turn the stove off, and they can't work because they have to go back home and check. You have to do things in sevens, right? Or numbers. I have to check the door 7 times. I have to do this 18 times. That's the personality. That's the disorder. Okay. They will come for treatment because they don't like it. The obsessions, the thoughts, the compulsions are messing up their life. They will come. It does get worse over time. So in a question, it might say, she's always had some anxiety. Her mother died, and she spends every waking hour cleaning the kitchen. Because the greater the anxiety, then the greater the compulsions, the more they go up. Okay? What they think is that if I don't follow my routine, if I don't check the door 7 times, if I don't do what I'm supposed to do, that I'm really going to something catastrophic will happen. That's the word, catastrophic. Okay. Okie dokie. So those are personality disorders. I'm going to go back to the questions because I really want to focus on how we answer the questions and what to look for in the terms, because that's what I hear a lot is I don't know, I don't know, I don't know. This is a code of ethics question as well. You see my screen? Yes. Okay, and you can put the answer in your chat box, please. Sarah is a therapist working in a community mental health center. She referred to work with Priscilla, a 19-year-old who is pregnant. During the third session, Priscilla lets Sarah know that she is strongly considering having an abortion. Sarah is strongly pro-life, but recognizes that she does not infringe her personal beliefs on Priscilla. However, she does provide her with a few pamphlets outlining the risk of abortion. In this situation, Sarah may have breached which of the ethical principles? Okay, again, you can answer in the chat box, but when we look at this question, I want to go back to the question. Don't just skim over it. You're going to miss something. I want to understand what it's asking me. So my client is 19 and she's pregnant. It's her third session, so I've known her for half a minute, right? And now she tells me she's considering having an abortion. The therapist is pro-life, but recognizes that her personal beliefs, right, my values have no place in that therapeutic relationship. None at all, right? My values are not going to change, but I'm not going to infringe my values on anybody else. That is never, never okay. So, however, she does provide a few pamphlets outlining the risk of abortions. In doing this, Sarah may have breached which of the ethical principles? And again, put your answer in the chat box. Informed consent, client abandonment, therapist furthering personal interest, or client autonomy. That's going to be client autonomy, right? Okay, that's client self-determination. Clients have the right to make their own decisions. We know, especially if you've ever worked with domestic violence in a domestic violence situation, we know it's going to happen again, right? We've seen this. If you've been in the field for half a minute, you know it's going to happen again. You want to scream to that client, run, leave now. That's not my choice to make, is it? That is not my choice. My values plays no role in that. So I'm going to remind her of the cycle of violence, right? The 3 stages. Okay, so it's the tension battering, right? The tension's coming up, then the battering incident, and then the honeymoon period, or sometimes it's called loving contrition. I'm going to remind her of those cycles. I'm going to remind her that many times those cycles get shorter, right? It might have been a year ago since the last time it happened, and then they get more frequent and more frequent. I cannot tell her to leave. I cannot report that to the police. That is not my job to report that. I can support her, right? If, and you won't see this on your test, but in real life, if the children see or hear it, you can report that to Child Protective Services because children are not supposed to see and hear it. However, I cannot do anything about that. She's an adult and I cannot report that. Okay? So be very clear about what the Code of Ethics says, what we can report. We can report anyone who's in imminent danger of hurting themselves or someone else. That does not mean that they're going to go and beat up, they're going to go and smash someone's car. Right? They can tell you sitting in front of you, I'm going to go in and slash my ex-girlfriend's tires. I cannot share that. No one is in imminent danger. If he says I'm going to go slash my girlfriend, that's a different story, right? But I cannot share that. Imminent danger. So if a client tells me, right, that they hurt someone last week, I can't share that. No one is in imminent danger. They can come in. I cannot share physical abuse either. I cannot. If you tell me you're going to hurt somebody, if you tell me that someone is in imminent danger of hurting you, or you hurting them, or you hurting yourself, that is all I can report. That is it. We are the secret keepers, right? We cannot share that. The Code of Ethics is very clear about that. So you're really going to first of all, informed consent. When a client comes in, you tell them, first of all, I can't share that, everything you tell me, right, is not confidential. You have to tell them up front. Yes, if someone tells me they murdered someone in the past, I cannot report that. No one is in imminent danger. And if that case goes to court, I still have to do everything I can. I'm going to claim privilege because I'm not trying to share that information. I'm the secret keeper. My job is to protect my client, right or wrong, right? Your lawyer, your priest, right? We don't get judgment. We don't get that. We get to do what's help our client and do what's best for them. So no, we do not share that. Okay. Let me just pull these up. Make sure you understand these terms. So be very, very clear about that. I also want to remind you very clear about the Tarasoff Act. The Tarasoff Act says that specifically out of California, it says that if someone is in danger, you report it to the person. Tarasoff. If it says Tarasoff out of California, that is the answer. If it talks about either a duty to warn, every state has a duty to warn, right? So you have a duty to warn either the police or the client. Both of those are not the right answer. If those are two choices, both are wrong. You either do one or the other. And because every state has a different rule, it's going to say either call the police, right? Or it's going to say, report it to the person or report it to authorities. But if it has both of those answer choices, neither one can be right. Because the duty to warn is different in every state. The Tarasoff Act specifically says that I'm going to warn the client. Okay? Code of ethics, make sure that you understand these terms. They're always going to be on there. Those are your principles. Autonomy is the right to self-determination. Clients have the right to make their own decision. Own decision, right? If they are underage, then I'm going to ask for assent, A-S-S-E-N-T. Or if they're not capable of making their own decision, someone who is older or maybe has some neurocognitive issues, right? Some dementia, things like that. So consent is legal. Assent is a verbal permission for someone who cannot sign. So then if I've got a kid who's 17, her mom and dad might very much sign permission for her to, come into therapy or do those things. But I'm going to still ask her, which is assent, A-S-S-E-N-T. Okay. So then, train of thought. When it comes to children, under 12 is always a minor. Anybody under 12 always requires parental permission. Okay. Over 12, it depends on the state. So we're going to assume in the question, it says they're 14. Unless the question says in your state you have to report, I can treat them without parent permission. They're still my client. That I hold their confidentiality if they're 14. I don't care what your agency says. I don't care what you do for the test, whether they're paying or not. That is my client. And I am not going to share because she is my client. If she's under 12, that's a minor, and that's always the right, that you cannot keep that. Over 12, then that is the answer. She's pregnant. If she's suicidal, the right answer is not to call her mom and dad. The right answer is to call 911 or have her put in the hospital, not to call her mom and dad. Okay, so the client is the client, and they're always the client. Non-malfeasance means do no harm, right? Okay. Benefice means I'm going to do what's best for the client as well as society. So non-malfeasance, do no harm. Okay. I will not harm the client. A client comes in and they say, oh my gosh, I want you to try this new therapy. My friend tried and it really worked on her. And you're like, I never heard of this stuff. I'm not going to do that. That's malfeasance, right? That could hurt her. Not doing that. Non-malfeasance. Benefice for the good of her as well as the client. Okay. Justice, that is, justice is social justice. I will do what's best for society. It is not fair that these kids over here get good therapy and they get all this because they live on this side of the track. Not fair. Part of what we do is fight for justice. Fidelity and veracity, I'll remind you, those should be your wedding vows, faithful and true, right? Veracity means that I will deal with you truthfully, and fidelity means I'll be faithful. I'll honor my word. So if a client said, the question says, oh yeah, I normally have a person that comes in every week at 6, but you know what, this week I'll move them back. They won't mind. You can't do that for the test. In the real world, I don't care. I only teach you the test. For the test, you cannot do that. You've got to keep your word. Okay? So remember those code of ethics as they flow through all of the questions. Pro bono does not ever mean I'm giving my services free to a client. No, 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 no. Pro bono means I will give my service to the community. So let's say that there's bullying going on in the school system, right? Or something is happening down the street. What I will do then is I will make sure, right, that I give my expertise, right? I'm a counselor. I've got these skills. I will donate my skills to the community. Never, never, never is it the right answer on the test to give your services for free. Never, never. We don't do that. Okay? I don't care what your boss says. I don't care how you do it in your own life. The test, that's not the right answer. Okay? Pro bono does not mean that. Miss anything else? Let's see here. When it has to do with drug and alcohol related to a minor, are we able to tell mom and dad? What do you think? I don't know what your name is. It just says the Ravenel family. Talk to me.
It's Lakeisha. It's Lakeisha.
Okay, Lakeisha,
I don't know. I
talk
think
to
in
me.
taking some practice tests, I've had that question, and it was more like, I think I answered it one time and I got it wrong. Was saying that, yeah, you can tell them. I think it's probably my answer.
Lakeisha.
Yeah.
Turn
Yes.
your camera on
Lakeisha.
if you're going to talk to me.
Okay.
Thank you. Let me see your
Let me
face.
get myself together.
Girl, I don't care. I don't care what you look like. Put the bonnet on. I don't care. Okay. I don't care what the background looks like. I just want to see your face.
Yeah. Let me
There we
fix my
go.
hair. Let
Thank
me
you.
get my hair to
I
going
do
here.
not care. I do not.
Okay.
Like, all you see
Hi.
is from here and up. You have no idea what's going on underneath here. Okay, so go ahead.
Okay, so I think in answering, I remember like doing a practice test and having that question, and I answered, I think yes, that you're supposed to tell them, but the answer was wrong, and I'm not sure it was actually the counselor's exam prep is what I read that question in, and I answered yes, you're supposed to tell them because I'm thinking that they're a minor, like you tell them.
Are they under 12?
I don't know if the question.
Okay, so listen, it doesn't matter. It doesn't matter. If it's a minor, if they're under 12, I'm going to involve mom and dad. I cannot treat them without mom and dad. If they're over 12, unless the question specifically states in their state that that's still my client. So I wouldn't tell drug and alcohol use either.
Yeah.
Right? And if they're, sorry, I was going to burp here. I had my Canada Dry. Sorry. If they are, they leave my office and they're drinking and driving, I'm going to call the police, right? So imminent danger means I'm going to call the police. I'm not going to call mom and dad first. That is not the right answer.
Okay.
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 Okay. And I also want to say that not all of the practice tests you do are valid. Okay, so don't assume because it's right in that one book that it's right for the test. Don't ever assume.
Gotcha.
Okay?
Gotcha. Thank you.
You're very welcome. Anybody else have a question while I'm here?
Yes, I had one. I put it in the chat just now, but I'll
Go ahead,
ask.
please.
With the mom and dad with a minor, well, no. Well, yeah,
Okay.
even with the minor, do you tell mom and dad if it's self-injurious behavior, self-harm?
What did I just say? No, I swear. And I'm not being sarcastic. I'm not. No. Are they going to die from self-injurious behavior? No. If they, if they're not trying to trick you, they're not. They're really not trying to trick you. They're not. Okay, so it's very clear in the code of ethics. If they're in imminent danger of hurting themselves or someone else, I'm going to contact authorities. Okay, so it's imminent danger. That's all that means. So they're not trying to trick you, and you're overthinking. Okay.
Yeah.
So as we get to the
Yeah.
test questions, but in my life, the test doesn't care. The code of ethics says, okay, we live and die by the code of ethics. If it were up to me, that's the only thing you would ever have to learn, because that's the most important thing, especially if we're the only one like us in our practice and everybody else is doing things that we would not do. But really, no, no, no. Okay, again, but it's a reading test. So if that question specifically says something like, she cut her leg and, her ankle is hanging off, yes, I'm going to call the police, but not the parents. Okay, imminent danger, imminent danger. Thank you very much for asking that question, guys. I'm
Yeah,
going to pull it.
I
Go
have a
ahead.
quick. Oh, so are they going to put an age to it, like 11 and under? Then you have to notify their parents that 12 plus.
If they want you to answer the question based on age, they'll tell you.
Okay.
So if it says 12, If it says an adolescent, again, they're not trying to trick you. Don't overthink it. They're not. They're really not. They're just trying to let you know that this is an adolescent. What would you do? Okay,
So
go ahead.
12 and older.
I say again.
Adolescent would be 12 and over. Older.
Yes. The code of the law is under 12 is a minor. I'm going to pick up some. Let's see here. Okay, so I'm going to go over a couple of questions, because most often if you're doing pocket prep, what happens in pocket prep is when you go over ethics, you get all of those assessment and research, and you're going, oh my God, I'm failing ethics. So ethics, go over some of these ethics questions, okay? And again, you can put your answer in the chat box. So I'm going to mute everybody again. Okay, so number one, the blank refers to the client's right to make an actions. Wow. Blank refers to the client's right to make and act on decisions as an independent person. Okay. Autonomy, justice, fidelity, and benefice. And remember, it's justice. It means social justice, but it is justice on the test. Okay, that's what we're looking for. And of course, we know that that is autonomy. That's client self-determination. Number three, when a counselor creates his own career test and offers it to clients without demonstrating test validity and reliability, his or her behavior is what? Oh my God, I saw reliability and validity and I don't know the answer. Oh my God, she put the like that. I know your hearts are like, no, okay, you know this, right? Reliability is consistency. Does it do it over and over again? Validity is, does it do what it's supposed to do? It's that simple, right? Validity is it valid? Validity is the most important thing as opposed to reliable, okay? So then, I haven't used this test on anybody before. Can I now use it and say that it's valid? I cannot, right? Okay, so unethical because the client shouldn't use their own tests on their own clients. Well, that's kind of true, but that's not the best answer, right? So I'd keep that in there. B, ethical if there's no financial gain for the counselor. That's kind of true too, but that's not the right answer, right? Unethical because the scientific procedures of test construction have not been established. That is C. But if you look down through those, a couple of those are right statements, aren't they? They just don't answer the question. So a lot of us will see the right statements, but if it doesn't answer the question, it's still not going to be the right answer. Okay? So make sure that you go back to the question. It is a reading test. Like this one. Number 10. Okay, again, you can answer, put your answer in the chat box. And as I'm going through, if you have questions, just put it in the box or raise your hand or something. Okay. You are counseling part-time in 2 different counseling offices while conducting a genogram. Genogram is by Bowen, right? Family structure. He talks about differentiation, generations, Bowen, right? Okay. So then you discover you are seeing sisters, one of each in the 2 offices where you're practicing. Oh Lord, one sister's in this office and one sister's in this office. What do I do? As a counselor, you should what? Okay. A, you're always going to read all of the answers. Always, always, always. Even if you're sure that you know it, go follow the process. A, recognize the 2 separate individuals and 2 separate practices as posing no difficulty to you as the counselor. B, terminate the second sister you've been seeing, tell her why, and offer her a referral. C, referring to the informed consent process, inform her that you have a conflict of interest because you're also seeing her sister. And if she is then okay with the situation, you may resume. Oh, that's a mouthful. I'd have to read that 7 times to understand that. I really would. And D, terminate the second sister you began seeing and do not tell the reasons for your termination, but offer her referrals. Oh my. What are we going to do on that one? That's a lot complicated, is it not? So dual relationships. So a dual relationship means that I have more than one relationship with you, right? Like you're my, you're my barber and I see your kid, or you're my mechanic and I see your kid. That's a dual relationship. And I can only have one relationship with the client, right? Only one. Sometimes dual relationships are unavoidable, right? I live in a small town. I'm the only therapist. He's the only mechanic. It's my job to make sure I set the boundaries under those relationships. But dual relationships many times are unavoidable. Okay? So then I'm kind of across the board. A, B. Show you. Ten is D. Oh my gosh, why? What happened? Let's go back to the question. Anybody pick D? Go back, anybody else? Did I see any D's?
But wouldn't that be abandoning the, I mean, I know you're referring her out, but why wouldn't you tell her? Would that be confidentiality for the other sister?
Okay. So the rule is whoever is your client first is the one that you are loyal to. So whoever is my first client, right? If I tell her the reason, then she knows her sister's in therapy.
Oh, and you can't break confidentiality.
That's HIPAA violation, right?
Yeah.
So I'm looking for a way that I can't see both of them, right? Okay. And then I'm looking for an answer that says, oh my gosh, what do I do? What do I do? So whoever's my client first is the one that I keep. Okay. And it's not abandonment because I'm referring her to somebody else. And
Right.
it might, go ahead.
Yeah. And plus you can't, you know, tell anybody, confirm or deny if anybody's in counseling, because
that is correct. That is correct. That is correct. Okay. So that is it. Okay. So, Justina, the question you're asking is why can't you see sisters? Because the code of ethics says I can only have one relationship with you. I can only be your therapist, right? So I can't be your sister's therapist, your mother's therapist. I can't do that. If I'm seeing you as a family, the family is my client. I cannot see you individually. Yes, I know every other agency does this. I know that you bill Medicaid for every single person that you see. That is unethical. Do not go back to your agencies and say, but Dr. Pam said, okay. Do know the code of ethics says it's not okay. If the family is my client, I cannot see the other people. This is my client, right? Not okay. A couple. So most often in the question, it'll say something like, you know, I'm seeing a couple for therapy. But if it says during the intake session, right, I'm seeing the wife in the intake session and she's having issues with her husband, I can then see them as a couple because all I've had is that one intake session with the wife. So I can do them as a couple. But if I'm seeing wife and I've seen her for 7 weeks going on, I can't see that. They can't come in as a couple. They have to go to see somebody else as a couple. I cannot do that. That is unethical.
I get that. I get that. I think the part that's throwing me off because he's seeing they're in two different offices. So why not treat them as two different? I get what you're saying, and I don't mean to be like the devil here, but I guess I'm just trying to say, I mean, this person's over here in office A and this person's in office B, and I'm not sharing what this person
Do you have a
said.
sister? Do you have a sister or brother?
I do have brothers, yes.
Okay. In therapy sessions, don't you be talking about your brother sometimes?
Yeah, I guess.
Okay. And when don't your brothers be talking about you sometimes?
I mean, yeah, but it's
Okay,
still
so,
your right as a
then,
counselor.
no. That's
Okay.
not, I'm human. I'm going to have some bias,
Okay.
right? Your
Okay.
brother said you did this and you up in here telling me you didn't. Oh, right? Don't do that.
Okay.
Just
Okay.
don't do that. Okay. And again, I only teach to the test. I only teach to the
Right.
test.
Right.
On the test, that's the wrong answer. In real
Right.
life, it's the wrong answer too. But on the
Okay.
test, that only teach to the test. Just understand that, okay?
Right.
And I know agencies do it all the time, and you probably did that today. The test, that is not correct.
Okay.
So let me go back. I just want to continue talking about, yes, a clean slate. Also, I don't want either one of the sisters to find out because they're going to question the confidentiality, right? I don't want to do that. Why take that risk? I know I'm the best therapist ever. I know that, but somebody else can have somebody, right? Okay. When it comes to couples, always remember when it comes to couples, I can't keep the secret and I can't share the secret. Okay. So the woman calls me and says, oh, I've got a lesbian affair on the side and I don't want to tell my husband. Oh my gosh, what do I do? I'm looking for an answer that says something about protecting both of them. Okay, because I cannot roll her under the bus, nor him. I can't say in therapy session, well, is there something you want to tell your husband? Is there something you want to tell your wife? I can't do that. That is unethical. I cannot do that. I'm looking for an answer that's very benign, right? That talks about making sure that I can't keep the secret and I can't share the secret either. So I'm going to say the answer is something like, I think it's really important that people are honest in therapy. Okay. Carla, I see you. What's
Yeah,
up?
Dr. Pam, I want to make sure because I appreciate how you tell us to read the test closely. Can I just see the beginning? I
You
want to make
can.
sure.
You can.
I want to see what I'm trying to make sure, did I miss seeing sisters? See, here's where I got confused. I got confused about who the first sister is and who's the second sister because it really doesn't say in that.
It does not. It does not. But let's go down to the question, okay? So it only talks about terminating one of them. It doesn't tell me first or second, right? So when it comes to terminating, okay, so B, terminate the second sister and tell her why. Unethical, right? C, refer to the informed consent process. Inform her that you may have a conflict of interest because you're seeing the sister. Violation, can't do that, right? So now between A and D, recognize the two separate individuals in two separate spaces as they propose no difficulty to the counselor. And I know that's what you guys do every day. That is not ethical. Okay.
So the
all I
sequential,
have, go ahead.
The sequential issue is not the issue. The issue is whether or not, as in the statement, whether it's ethical or not. Telling her why. And okay, so that
you got it. Okay. So that's what they're looking for. And I mentioned earlier, right? These are code of ethics questions. And they can be written in many different scenarios, right? This is a code of ethics. A code of ethics says, I can't do this. Okay.
Okay.
And those of you that struggled with this, I think many times this is a typical question. They're like, what the heck did they say? Right? First of all, I don't even know what they said because the question is so long. So go back to the question. How do I know? How do I know? How do I know? It is a reading test.
Thank you.
You're so welcome. $15, okay? An insurance company requests the primary diagnosis of a client you are counseling. You should, A, release don't answer until I say so, please. Hold those answers because I don't want groupthink. Groupthink is the process that we all think the same thing because somebody answered it first and they must be smarter than I am, right? So no, 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 no. So please don't answer until I say so. Everybody know what groupthink is? Are we good with that? Okay, so groupthink is you know, you're in a business meeting and the boss says something stupid, right? And everybody agrees because they're afraid to say something. I'm going to close my windows. I'm gonna pull that one up, but that's what it looks like. So you're all at the table, right? And you're a business meeting and the boss says, oh, you know what? I think on Friday, we should all come dressed in our pajamas. That's a good idea, right? No, oh my God, no, no way, no how. But no one's going to say anything because they don't want to disagree. They want, it's amicability. They want to be amicable. They want to be liked by the boss. So if one person says no, other people will say something. Okay, so sometimes you might see this. The term is Confederate. A Confederate is a fake person, so he might put a Confederate in the group because if that one person says no, then other people will stand up and say no. Okay, so what I use that term to say, don't answer yet because I don't want groupthink mentality. Because a lot of times you're unsure, you're afraid to answer, and you think you're pressured to answer, and you want to answer because everybody else said A. So just don't answer until I say so. Also, I really don't care if you get the question right. This is not a oh my God, I'm first. This is, do you understand why? Okay, so if you don't understand why you got the answer, you won't pass the test. You can memorize, you can do all that stuff, but you're not going to pass unless you know why it's the answer. By the way, pocket prep is not studying. Pocket prep is not studying, I'll make that clear. You can do the questions, and if you're saying, oh my gosh, I'm doing so much better on pocket prep. Girl, you're saying the question 12 times. Of course you are. Okay, that's not valid. Sorry. And I'm sorry for the men in the room. Man, you too. Okay, so I'm sorry. But it's not valid. It's not valid. And you think, oh my gosh, I know this now. All you know is the one answer to that one question. You still don't get the content. Okay, if you're going to use pocket prep, in the back it tells you, right, where what page it came from. Go back and study it so you know why. Lisa, I recommend 3 hours a day, 6 days a week for 90 days. That is our program that we teach. 3 hours a day, but same thing. So if you're studying careers, we'll break it down to like Super. Super has 3 different career theories, right? He has the rainbow, he has the arc of determinants, and then he has the level, the stages and ages, right? 3 different theories. If you didn't know that, you're like, oh my God, what are 3 theories? So what we recommend is that just in the morning, you just learn one of the theories, right? So you're going to, if you're an auditory processor, listen to a video, find one of my videos. You can find one at, the Purple Book videos, but I think mine are so much more fun. Make your own video, right? Listen to that in the morning while you're getting dressed. Same content at lunchtime while you're having lunch. If you're an auditory processor, you're listening. If not, then you're writing, okay? And then at the same time at the night. Same content though. You cannot leave that content until you can tell somebody else in your own words what it means, okay? So you can go up to your husband or your dog or your wife and say, did you know that life spaces and life rainbows, that Super said that I can play the child's role between the ages of 0 and 60, right? That's when you know it. Because the test is not just regurgitating what you've memorized. You have to be able to apply what you've learned. If Kara, you said you were fine, girl. You don't need to worry. Okay, so We do recommend 90 days. And honestly, you have what you have, right? We can't, you have what you have. It's that simple. But we do recommend 90 days. And I don't recommend any more than 90 days either, because at some point you are so tired of seeing these things on the test. Like, oh my God, get it over with. Okay. Where was I going? I lost my train of thought now. Now I know I'm ADHD. What was I talking about?
We're going to do question 15, I believe.
Thank you very much. Okay, so 15. An insurance company requests, oh, I started off by saying, please don't answer. That's how I got here. An insurance company requests the primary diagnosis of a client you are counseling. You should, A, release only the primary diagnosis to the representative. B, release all client records to the company so the reimbursement can be reassured. C, refuse to release any information unless the client has given prior consent. Or C or D, release the information if you feel like it'd be in the client's best interest. Okay, don't answer yet. So what I know in the question is that an insurance company requests the primary diagnosis of a client. I want to remind you, you do not have to diagnose. You know, Carl Rogers did not. And a test question might be, do you have to diagnose? You do not. We diagnose so we can get paid. Okay, but on the test, if you see, you know, do you have to diagnose? No, you don't. Yes, we have kids to feed, right? But for the test, you do not have to diagnose. Okay, so let's see some answers. What am I going to do? What I should have done is ruled out, right? And then gone to the best answer. C, 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 D. Around the board there. Let's go see. C. Let's go back and see why. Refuse to release any information unless the client has given prior consent. What? Do you, when you go to the doctor's office, right? Does he say, can you please sign this so we can bill your insurance? He should. Okay, if he doesn't, so oh my gosh, the receptionist lady, you're supposed to sign the HIPAA thing, right? And then you're signing the release so you can share the information with the insurance company. If your doctor's not doing that, they're violating code of ethics. Okay. Yes, before I share anything, I have to make sure it's okay with the client. Okay. I changed that first thing you said not to do. Dang. Okay. So you can write that in on the test, right? I meant to write, not going to help you on the test. Okay. We don't do anything without the release of information from the client, right? We do it all the time. Most of the time, if you work in an agency, it's been done before they get to you, right? Someone out there, the receptionist, the screener, someone has done that before they get to you. Okay, but I always want to make sure that the client has permission. In the real world, not on the test, but in the real world, there are people who pay cash and they don't want you to bill their insurance. They don't want you to tell their insurance. So always, always, always make sure. Also, if the insurance company asks for additional information, before I send it, I go back to the client again. They want to know this. Okay. So be sure that you do that as well.
Dr. Pam.
Uh-huh.
Real quick on that specific question. I've only had internship experience and one, everything was electronic. And after the second session, excuse me, we had to diagnose. And I didn't like that because I felt like I didn't have enough information to go by diagnosing. But for the sake of the exam, it's confirming with your client to release that information, correct?
Yes. Okay. And if it's diagnostic question, it'll say in the question, you know, she's got this and this and this. Okay. So it's a reading test. They're not gonna, you're not pulling things out of the air. And most agencies do that. I work for agencies that we had to diagnose within 24 hours because that's how we get paid.
Yes. Okay. Thank
So
you.
That's the world, but that's not the test. Remember, this task has nothing to do with what you do every day, unless the question says, according to Jessica. That's not the right answer. Okay. 19, I think we talked about this. A client tells you that he knows someone who is threatened to commit a violent crime. He knows someone who has threatened to commit a violent crime. What should you do? A, should do nothing because this is secondhand information. B, are legally obligated to report this information to the police. C, should encourage the client to report this information to the police. Don't answer yet if I didn't say that. Don't answer, don't answer. D, are legally obligated to keep this information to myself, confidential. Okay, so this is what happens, right? A lot of those sound right. So this is a tough one. I get down to the question, and then, A, should do nothing. 99% of the time, do nothing is not going to be the right answer. Okay, so it wouldn't be on the test if it's a do nothing. So that's almost always. Also, look out for alls or nones, right? There are very few things in life that are never, or very few things that are always. So then, I'm going to take A out, okay? B, I'm legally obligated to report this to the police. C, I should encourage the client to report this information to the police. Or D, I'm legally obligated to keep this information confidential. You may answer the question, please. See some C's, some D's, C's. C. Let's go back. Okie dokie. Someone who picked C, tell me why. Janice Davila. Come on down. Why did you pick this one? Janice. Janice. I guess she decided that she doesn't want to answer. Okay. Desiree, is your hand up?
Oh, yes.
Okay.
Because there's no imminent danger. So she should just encourage the client to tell.
You got it. You got it. You got it. The problem with D is I'm not legally obligated. I'm ethically obligated, but not legally. So that's the problem with D. Okay. So all of you like, I've got to keep the secret, Dr. Pam, I've got to keep the secret. Okay. But not, you won't go to jail if you share the secret. You will be called in front of the board and maybe sanctioned, but you won't go to jail. Okay. So do you understand how important did I say it's a reading test? It's a reading test because ethically I am obligated. Well, he's not, I guess I am. He's not my client, but yeah, whatever a client tells me. So yeah, I should not share that. I'm ethically obligated, but I'm not legally obligated.
Okay, so if they had ethically in there, then D would be the answer. Or ethically obligated.
I don't like obligated. So if it said, according to my code of ethics, I'm going to keep the information, then that would be the right answer.
Okay, without the word obligated.
Yeah. Okay. So those little words matter. They matter. So if I tell you that take your time, because those of you that went, okay, take your time. The D, that one word makes it not correct. Like, what? That's not fair. Okay.
So I have another question.
Yes.
On the limitations of the confidentiality, those are both legal and ethical? Just ethical?
So it's if I don't, well, let's go back. I am legally obligated to tell if someone is in imminent danger. Yes. So if my client goes out and kills somebody and I knew and I didn't do anything about it, then I'm probably going to be arrested because I knew and I didn't do anything. I didn't tell anybody. Accessory before the fact. So I don't know. I didn't go to law school. So.
Yeah, they always warn us about, like, every client I meet that's new in my internship, we have to use confidentiality speech and give the limitation that will confidentiality. And part of it is if you're going to hurt yourself or others,
Mm-hmm.
you know, a child is in danger or an elderly adult.
Mm-hmm. You're absolutely right. Absolutely right. Let's stay there for a moment with the child. Oh, you want to do the Tarasoff question? We can do that. Okay, so with the child and sexual abuse, if a child is under 18, she's 17, and she reports that her dad abused her when she was 12, that I report. If she is 18 and said dad abused her when she was 12, I cannot report. She is an adult. I can assist her in making that call, but I cannot report that. She is an adult. Okay.
And it's up to her. We can, you know, help her make that decision for herself, you know,
We
give
can.
cons, but she has to make the decision. We can give her the number to call. She can call in our office and we can just sit beside her while she talks to whoever she's reporting it to, but that's the extent, you know, right?
Amber, you are definitely an auditory processor.
Yes.
You need accommodations because you need to talk out loud.
I'm like the house.
Just saying.
I'm like the house.
Because you just need to like process that, process that. And that's not a bad thing, but in my group, I cannot have you process that out loud. We're never going to get it done, okay?
No wonder.
Okay, it's okay. It's really okay. Process it out loud with your mic off. Okay,
Right.
so
By myself.
okay, so the Tarasoff question that somebody asked me about that I went past. Let's see, what was that one? Remember, I told you the Tarasoff Act is out of California. It happened. What happened is because the counselor did not warn the girl that his name was Podar, that Podar was coming after him, and he knew, and he did not warn her. So that actually was huge, groundbreaking legal precedence. So the Tarasoff ruling established that a counselor must brief confidentiality when he or she is what? A, feeling that the client is exhibiting anger toward his or her spouse. B, has a client who presents a threat of violence to an identifiable victim. C, wants to get advice from another counselor. Or D, is asked to do so by the parent of a minor child. Okay, that's B. We're good with that one. That's simple. Tarasoff specifically says, right, if the client presents a danger to an identifiable victim. I've had to do that. I'm from South Florida, Miami area, and I had a client that I was seeing. He was stalking his ex-girlfriend in high school, small town, and his mom and dad had sent him like to South Florida as far as way you could get for school. And so part of that was like, you know, to keep him away. Thanksgiving, mom and dad wanted him to come home. And I'm like, no, I don't think so. I think he's still a danger. No. Christmas, school closes, so he has to go home. He would not contract for safety, that he wouldn't hurt her. So then I had to call, and he wouldn't give me her name. All I knew was the girlfriend. So I had his address because that was on the file. I called the police, and they went to high school together. I knew that as well. I called the police in that county and did a warning, but because he was coming, and I really thought he was still going to hold her, so I did have to do that warning. And he got picked up. The police picked him up, and he actually brought me the newspaper article. Look, I got arrested. And small town, they just sent him back to school. So that was their approach, but I did have to do my part of calling. And again, I didn't know her name, but I knew enough to make that report. That's what that looks like, if someone was in imminent danger. This one, records. When it comes to record keeping, follow the laws of your state. Follow the legal and ethical issues of your state. Some states say 7 years, but not every state. So if you see 7 years, that is not the right answer because every state doesn't do that. Okay? Since we're still struggling with this one, let's do 22 again, 22 as well. A counselor may break confidentiality when, do not answer, please, do not answer. There is a danger of abuse or molestation of a child. B, a client who holds client who holds the confidence privilege gives him written permission. C, the client tells a counselor he has the intention to harm another person with whom he specifies, or all of the above. There are not any all of the above questions on the test. Don't be fooled. This is just a practice test, right? Okay. So I may break confidentiality. Did I say answer? I see all the questions up in there. Yes, you can answer. Okay. So yes, all of these are true. There's a danger of abuse of molestation of a child. Okay. The client who holds the confidence privilege gives him written permission. Privilege is the legal term. If I get called to court, I claim privilege. Privilege means what this person told me in confidence in a session. They had never had any belief that anybody else would hear it. Okay? So that I have to go, I have to show up, and I have to claim privilege. If you get a subpoena or a court order from the court, show up. They'll issue a bench warrant if you don't. Show up. Okay, real life test answer. Show up. A court orders for the records, a subpoenas for your mouth. They want you to talk. Okay, so if you work in an agency, of course, go up the chain of command. Make sure you're a supervisor. You may have a legal team, but show up. You cannot ignore that. If the question says go to your client, if one of my responses are, I'm going to let my client know, right? But I'm still going to show up. And if I claim privilege and the judge says, Dr. Pam, keep talking, I'm going to keep talking. I'm not going to jail for a client. So legality trumps ethics all the time. Okay. It is unethical to sleep with your client, right? Unethical. After 5 years, right? 5 years. If you're a psychologist, you get 2 years, just so you know, 5 years. However, I won't go to jail, right? Someone will call me in, they'll report me. I might get some points off my license, but I won't go to jail. It's not illegal. It's unethical. So remember, law trumps everything. I am not going to jail for anybody else's stuff. It's going to be my stuff when I go to jail. And you'll know it'll be something big. Go ahead. I see some hands up. Laterica?
Yes, for the question number 21 about the records, what would be the right answer? I know you said different states have different rules.
Let's see here. Never keep the records. Do confidentiality. Always keep them. Sometimes keep them. Only keep them if there is required. I would go with A. B. Always keep them. Let's see what 21 says. B. Always keep them.
Okay, thank
That's
you.
the best. So I'm always looking for the best of the four, right? That's the best of the four. Okay. Desiree, was your hand up? Did I get that one?
That was from before. I'm good.
Okay. Okay. So I'm going to go over to human development. Okay. Because that is one of our hardest areas. People usually miss a lot of points there. Okay. So I'm going to go over some of my theorists, and then of course I'm going to come back and ask some questions. So I'm going to ask you to just kind of hold your anyway, please hold your thoughts to the end. 1 second, guys. Let me just answer this. Okay. I'm going to here. Okay. So Piaget, he is my cognitive therapist. If you are not following me on YouTube, be sure that you go back and you are listening to my YouTube channel. I have like short vignettes, or my 10-minute things, I call them, on the theorist. Okay, so they're going to be on the test. I don't care what anybody says, they're going to be on the test. Okay, so what it looks like is, okay, so what it looks like is, hold on. I'm sorry. I'm going to not be distracted. I'm trying to buy a house. I have, after you've tried to buy a house in this, it's a market like you would not believe. I'm trying to downsize. I have a 5-bedroom, 4-bath. I got the kids are all gone. I'm trying to downsize, right? A little bitty townhouse. That's all I want. But I don't know where you live. The market is crazy. So if it lists, twice I put an offer down and a good offer, and it like listed on Thursday and it was sold by like Monday. So I'm like, I put an offer in yesterday, and I'm like, well, I need to know. So I apologize. Okay, I'm human, and I need try to downsize. Okay, so the prices are crazy, but that works well for me because I'm trying to downsize. I got a big old house to sell. I just need to find some place to go. Okay, so back to Piaget. I did. If you don't know my story, I was married forever. My husband died. I have 3 children. My youngest one is 18. They're all grown. They live across the country. So, I'm mom. That's all I would ever do was be mom. And so I didn't get my PhD until I was 50. I started at 50, so I got like 54. So just kind of know I'm normal like everybody else. Okay, when I need a house. Okay, so SPCF, that's what I'm going to remember. Sensory motor, preoperational, concrete, and formal. Easy to remember those, SPCF. But what I have to know is what happens in the stages, okay? So sensory motor stage, object permanence develops. Object permanence is I know the ball is still there. Before 6 months, peekaboo, oh my God, mother's dropped off the face of the earth. They really think you're gone, 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 gone. After 6 months, they know that you're still there. Those of you that are taking notes, I talk really fast just to get all this in an hour. So, you get a recording of it, I promise. But, you might just want to be with me because I'm just going blah. Okay. So I'm trying to brain dump. So SPCF, sensory motor, those are my babies. They learned the world with their 5 senses, right? When my son was little, we're at the mall and he had a cigarette butt in his mouth. Ah! My first child, I'm sure he's going to die, right? Your 3rd child, you're like, whatever. Okay, but really, that's how they learn. Sensory motor, they're learning to see the world by motoring around in their 5 senses. And then what we're looking at, of course, is object permanence, which is different than object constancy. Object constancy belongs to Margaret Mailer, right? Margaret Mailer, she is I'll come back to her, don't let me forget. Okay, sensory motor, find the ball, look for the ball. Preoperational, the goal of that one is egocentrism. Centrism means the center. I believe that I am the center of the earth. 2 to 7-year-olds, you can use this in everyday language. When you're at the grocery store and you see this kid acting up terribly, just say to the mom, it's okay, your kid's terrible. He's supposed to be, right? That's normal. he's normal. So really it's about me. They don't get that I have to share. They don't get that there's anybody else in that world but me. What that might look like on a question is, there's mom and dad are getting a divorce, right? And the mom brings a 5-year-old in because she's extremely upset about the divorce, right? What she's upset about is because she thinks it's her fault, because the world revolves around me. The sun came up this morning because you put it there for me, right? Mine. I go to the store, I didn't have a ball in my hand, but when I leave, I do, and it's mine. It's mine, okay? Parallel play is very common among 2 and 3-year-olds. That means that they'll play beside each other, not play with each other. That does not mean they're autistic. You might sit on the question if they're playing beside each other. No, that's normal for 2 to 3. Me, right? I'm not going to play with anybody else because no one exists but me. So that is in the goal of the preoperational stage. In my concrete stage, I develop conservation. Conservation are the fact that those 2 glasses hold the same. I always think of conservation when we had to conserve water. So that is what that looks like, okay? So that is the concrete stage. I know now that those 2 things hold the same. Prior to that, I did not know that, okay? In the concrete stage, I'll say very concrete, very literal. So they don't understand metaphors. They don't understand, if you're my age, I'm old, 56. My mama used to say, that she's going to go see a man about a dog. In that age, I'm like, Mom, where's the dog? You said, where's the dog, right? In the formal stage, I knew that meant none of your business, Pam, right? But in the concrete stage, okay, I'm very, very literal. In that concrete stage, Mom says, if you lay down with dogs, you wake up with fleas, right? That age, I'm itching, Mama, I got the fleas, right? Formal stage, I don't want to be itching because be careful who I sleep with, right? So, but I understand that in the formal stage. I didn't understand that in the concrete stage. Okay, so SPCF, that is Piaget. Piaget is a cognitive therapist. The word schema belongs to Piaget. The schema is the way that you see the world. Okay, so we have assimilation and accommodation. Assimilation, you'll see that exact same term under culture. Okay, so assimilation means that it looks as similar. So first of all, children assimilate. So in the picture, like she sees the dog with 4 legs. So she thinks, okay, all things that are furry with 4 legs, they must be dogs, right? That's assimilation. My schema, my brain has now understood these two things are similar. Then Dad says, well, wait, right? This is a dog. This is a cat. They're different. Now I have to make room. I have to accommodate my schema for the new information. Assimilation is first, and then I accommodate to make new room for that. Okay, again, we're looking for the terms that belong to him. So schema, assimilation, all of those things belong to Piaget. Piaget has a morality theory also. We don't teach that, but you might see a question on a practice test about Piaget's morality theory. That's almost always not a test question because we don't teach that. However, his good old buddy Kohlberg did. So Piaget and Kohlberg were buddies. That is why their theories sound very much alike. Okay, so Kohlberg has 3 levels, but 6 stages. On the test, they're always going to be 1, 2, 3, 4, 5, 6. They're always going to be together. Okay, so pre-conventional, those are my little kids. Those are the kids that just will do what they're supposed to do because it's good for them. I'm getting something out of it. So that my level 1 kids, that term naive hedonism, right? It's good for me. I won't get in trouble at school all week because I get to pick from the treasure chest on Friday, right? No morality. I haven't learned it yet. It's just good for me. He said children weren't born being moral people. We had to teach them that. My conventional level is 7 to 11, okay? So he said most people stop there. I'm going to follow the rules because they're the rules. I conform to avoid censorship by authorities. I'm going to stop at the stop sign because the law says I should stop, right? I'm going to go 55 because that's the law. So I'm going to conform to avoid disapproval or dislike. I want everyone to know that Dr. Pam is a good girl. I always follow the rules. Never. Okay. He said most people stop there. That's your conventional level. There are a few of us who are post-conventional. So if the question says Pam stops at the stop sign because she's aware that it could, if she doesn't, she could kill people, or that, she may run into somebody, that's post-conventional thinking, right? I'm stopping it based on my own beliefs, my own morality. People at the post-conventional level, right? Okay, so those are the people that are going to go by their own morality, knowing that they may get in trouble. I talk about the civil rights movement always, right? Any of the John Lewis that crossed the bridge, anybody that sat in on the sit-ins, that got hosed down by dogs. The Rosa Parks, right? She knew that was breaking the law, or the laws in the South were enforced. She knew that. However, her own morality was above the law. Okay. The woman in Kentucky, when Obama first legislated gay marriage and she refused to sign the marriage certificate for two men, she knew she'd lose her job. It didn't matter. Her morals are above the law. Okay, so the people in the post-conventional stage, and there's not a lot of us, he said very few people get there, okay, that I'm going to conform to maintain community rights, but the emphasis on my rights, the individual rights, and my individual principles, my conscience decides which rules and which laws I'm going to follow. And I'm aware of the consequences, right? Back when we were mandated to wear mask, okay? So give me 1 second, guys. I'm sorry, it's not real. Give me 1 second. Sorry. Okay, so Jack Kevorkian, that's the other person I always talk about. Jack Kevorkian, remember back in the day, if you're not old enough, he is the one that he started euthanasia. He had a euthanasia machine where he would put people who were terminally ill so they could die. He went to jail. He went to prison for 20 years for that back in the, oh gosh, I guess probably 70s, early 80s. In many states now, it's legal. If you choose to die, you can. So again, while he knew that it was illegal, he really believed that people should have that right. Okay, so very few people are going to be in that post-conventional stage. You're never going to see 2, 3, or 4, 5. You're always going to see 1, 2, 3, 4, 5, 6. But if the question asks you how many stages there are 6, but 3 levels. Okay, that is Kohlberg morality. Now, Kohlberg, Carol Gilligan, you'll see her under the feminist theory. Carol Gilligan worked with Kohlberg, and women kept failing Kohlberg's morality test. And he was saying that women just aren't moral, right? And what Carol Gilligan came along and she said, women aren't born without morality. We innately, instinctively have some different morals than men, that we're more caregivers than men. So women are moral. We just didn't follow this conventional moral state that men go through. So that is Carol Gilligan. You'll probably see her on the test as well. Okay. When it comes to, of course, Freud, he is seen in both places. I'm going to come back to him later, Mr. Erickson. Erickson, you have to know the ages and the stages. You can't kind of know because it may not give you like the right, they don't have to match up with the ages and stages. They may not be the same. Erickson said that you could get stuck in a stage. So you might see a question about a 55-year-old woman who has never fallen in love. And according then to Erickson, she is still in that intimacy stage, even though she's 55. Right? I know. Okay, so I have to know the ages and stages, and I have to know what happens in the ages and stages. Erickson was psychosocial. His first 3 stages line up with Freud: oral, anal, phallic. Sexual stages of Freud, not sexual with Erickson, but they match. Okay, so trust versus mistrust, that's the same as the oral stage. Autonomy versus shame and doubt, that's the anal stage. Initiative versus guilt, that's the phallic stage. OAPLG is Freud, right? Those 3 stages line up. That should make those easy to remember. So when you're thinking of autonomy versus doubt, you're thinking potty training, right? Initiative versus guilt, that's the sex thing. So a question might say, little Barbara asked a question about something, or looking at, her brother's private parts, and the mother says, oh, don't ask that. They take initiative and then they feel guilty. Okay, those 3 line up with Freud: oral, anal, phallic. Got it? Oral, anal, phallic latency with Freud, nothing happened in the latency stage, right? And the genital stage is where anything is about intercourse. The phallic stage, that is where you find the toy box between your legs, according to Freud, right? So the Electra and the Oedipus stage develop. The Electra is when the girl is in love with her dad. Oedipus, it starts with an O, but it's still Oedipus, little boy's in love with his mother, okay? So now I've got through those first 3 stages, and now I am starting elementary school. In elementary school, I need to find out what I am good at. Okay? Industry versus inferiority. Have any of you ever seen my videos? Do you know what I was good at in elementary school? Spelling bee champ! 3rd, 4th, and 5th grade, Bricky Elementary. Yes. So what the question really talks about, if you remember, the industry is what your town is good for, right? You're known for your industry. Forever, Detroit was known for cars. That was their industry. Not anymore, but that's what we think of, right? So your industry is what you're good at. And what he said is, in elementary school, you've got to find out what you're good at. If you don't figure that out, you'll feel inferior for the rest of your life. Okay? Looking back, you remember the kids that couldn't read that sat in the back of the class? We all knew them, right? Might have been one of us. Okay, I'm not saying, but we do, right? We remember that. So the goal is, most often on the test, what it's going to say is something about school. Okay, and Mary can't keep up with her friends. But the goal to help you remember is you've got to be good at something in elementary school. That's why we put kids, right, in every sport there is: dance, ballet, soccer, karate, basketball, piano, right? We're trying to figure out what they're good at. Okay? Personally, if this anecdotal helps you remember this on the test, when I haven't done therapy in forever, but when I practice, I tell parents, it is not okay to take a kid out of a sport that he's good at because he's not doing well in school. Kids have to feel good someplace, okay? And if that's the place that I feel good, then you'll punish me another way, but don't take that away. We all need some place in elementary school to feel like we're good at something, okay? I went to predominantly white school, and all the other kids thought because I was 5'9" that I could, play basketball or run track. I can't. Thank God I was smart. I already felt inferior because I couldn't do those things. But that wasn't me. That wasn't my industry. Both of my brothers are football players. My husband was a football player. All these sports people in my life. That wasn't me. Okay. So industry is what you're good at. Now we start we start middle school. Okay. Middle school, I am middle school 13 to 21, right? You guys remember middle school, how awful it was? Oh my God, your armpits stink, and some people had breasts and some people didn't. Oh. Okay, so in that stage, I'm supposed to figure out who I am, my identity versus role confusion. So I need to know who I am, what I'm good at. Okay, so in 8th grade, when I'm first starting, that's about that age, we want to dress alike, right? Oh my God, what are you wearing to school today? Let's all get our nails done the same color. Oh, let's wear the same matching earrings. Okay, but Mom, everybody has it. I'm sure none of you behave that way during that age, but that's a typical age. That's what we wanted to be like everybody else. But by the time we're 21, we should have figured out who we are, right? At 21, I'm not, me and my girl can't show up at the party with the same dress. That's not okay. One of us would have to go home. So in that stage, I know my identity as well as my sexual identity, who I like, what I like, tall boys, short boys, green boys, yellow girls, what I like, who I am, true to myself, what I like. Okay. So then if you see, so now that I have at 3 to 5, it's my purpose, right? Now my competency, what I'm good at happens in elementary school. In between 13 and 21, fidelity, true to myself, knowing who I am. Once I know who I am and who I'm sexually attracted to, then I go to the next stage, right? I can find intimacy. So Erickson said that you should be in a relationship between the ages of 21 and 39, right? That you should be in some sort of relationship at that point. 40 to 65 is that stagnation versus generativity. That's the stage that I'm in. Stagnation means going forward, leaving a legacy for future generations. Okay? If I'm stagnant, I'm not. In a question, what that may look like is, Mom, Pam is divorced, right? And her kids are grown and she never checks on them. I'm stagnated. So generativity, and if you remember, and this is the way, if you're my age in this age group, I'm 56. I don't have another good 56 years left. Just facts, right? So what I want it to matter that I was here. And yes, my own children generational, but also that's why I do what I do, right? Because I won't be here and I want a little part of Dr. Pam to be with all of you, right? When you're out there practicing. So leaving a legacy, making it matter that I was here on this earth. And if not, I'm stagnated. And the last one, of course, is integrity versus despair. And I always say, gosh, why couldn't I have gotten wisdom earlier? It'd been great if I got wisdom a little bit earlier. So that is, I'm really good at integrity is I'm good with my life. Ego integrity, I'm looking back over my life, right? I'm happy with the choices that I made, or I'm in despair. And those are the people that are the shoulda, coulda, wouldas. The people who I'll say they're just too angry to die, too evil to die. Okay. They build on each other. Erickson said, yes, you can get stuck in those stages. Okay. So know that just because I'm 65 doesn't mean that I'm in generativity. If I have never gotten to know myself, I am still going to be in that stage of identity versus inferiority. Okay. Let's see what that looks like in some questions. You'll get a copy of this book. Just remember, I use both. I use lots of books for lots of studies. I teach many different disciplines. So everything I use today, you'll get. This is a social work book. Don't call me going, oh my God, I don't know this stuff, right? Because it wasn't meant for you, but some of the questions are exactly the same. Okay. Psychology, Freud and Piaget, they're going to be that no matter what discipline you're studying, right? That's the basic roots of where we came from, our disciplines. Get my book. Maybe I won't use that book. Okay, I'll look for that one. Let's just go ahead. If you're doing a test prep and you know the answer to these questions, please don't answer. Okay. So test prep is a good study material. This is the online version. I do have the book for it as well, and I'll send you that I'll send you that as well. Where's my mouse? Okay. There's an online version and there's a book version it's called 800 questions. And again, I'll send that to you as well. This one is not necessarily how the test questions are written, but it's good for learning content. And we've got to spend some time learning content. Okay. And put your answer to the question. Please put your answers in the chat box. I'm going to kind of fly through some of these. Okay. The time that premature babies spend in the neonatal intensive care unit can have the most impact on their sense of what? Okay. You got it. Trust versus mistrust. Perfect. That's it exactly. Good, good, good. Okay. So part of human development is also knowing normal human development. Okay. This question is asking me about the circadian rhythm. The circadian rhythm means that we should go to bed when it gets dark and get up when it's light, right? That's what that means. Okay. So this is about asking about adolescence, because we know that adolescence, that's very much a growth spurt, very much like babies, right? So this question says, to be in sync with the brain's natural clock or the circadian rhythm, most adolescents need to do what? I don't know if we'll see this test, but on the test, there's a word called, it's called your personal fable. Your personal fable is what you believe, what teenagers believe about themselves. Remember, teenagers think that they're never going to die. They do like really crazy things because they're never going to die. I'm sure none of you were ever 18, 19, 20, did crazy things, but that term is personal fable. I see B's, C's, A's. So they need lots of sleep like little babies. Okay, so they need to go to bed early and get up late. Oh, that one. B, there we go. Go to bed late and get up early. So due to the fact the release of melatonin occurs in the late evening for adults, for adolescents, they are not tired until later in the evening. So your kids that stay up like later at night, because that's what adolescents do. That's normal adolescent behavior. Again, easy question. You won't see something this easy. You might, if you're lucky, get something this easy, but not in general. Which psychologist identified the sensory motor, preoperational, concrete, and formal stages? Who was that? Of course, that was Piaget. Okay. I mentioned her a minute ago, Carol Gilligan. She's the one that worked with Kohlberg. Okay. Remember, it's a reading test always. Psychologist Carol Gilligan developed her theory of moral development specific to women because she felt Kohlberg's theory of moral development was less appropriate for females because. Okay, so again, make sure I understand the question. I'm going to go through that. I'm going to rule out what it can't be, right? And then decide what my answer is. I'm just going to stretch here, guys, for a minute. Okay, so which one? I see C. C's? Yes, yes, yes. Got it, got it, got it. Okay. Good, good, good. In the United States today, which of the following would have the highest life expectancy? So this is under normal human behavior, but it might be under one of the diversity questions. The highest level of expectancy, if you don't know that, you should. Hispanics, Hispanic women. And we're not really sure why. So they live longer and they're healthier, right? Well, that's Hispanic women. Don't know why. And I don't know where the study came from. I can just tell you that's the right test answer. Also remember that if we looked at that question about statistics, that by 2030, we think the majority of the United States will look more brown and black than white, right? So one of the reasons is because of the influx of Hispanic people in the country. Many of our Hispanic people are Catholic and still use the rhythm method. So many times, many of our Hispanic people still have large families. They're blessings from God. So it's not uncommon to see many of our families with larger families. So thank you. And if I'm incorrect describing anything about Hispanic people, please tell me, okay? Because I'm just, but so as most Americans, we would rather have the big house and 2.5 kids, right? That's what we want. But many Hispanics see the blessings as the children. Those are blessings from God. So it's not uncommon to see families with 7, 8, lots of kids. And many times it's because of their religious beliefs. Oh, go back. Neurocognitive and neurodevelopmental. Neurocognitive disorders are things like Alzheimer's, dementia, things that happen later. Neuro is my brain. Cognitive is my thinking process. Neurodevelopmental are things that I am born with. Autism, Down syndrome. So neurodevelopmental, born with, neurocognitive, things that I develop later. Now, we used to have them divided. So they're divided between major and mild. So Alzheimer's in the beginning would be a mild neurocognitive disorder, right? But as it progresses and you don't remember your name or your wife's name or your family's name, then it's going to be a major neurocognitive disorder. Okay? So it is all of the above. And again, you won't see that on the test. Those are just so you can understand what major neurocognitive means. Okay.
Dr. Pam, could you repeat the neurocognitive explanation and the neurodevelopment?
I sure can. Neurodevelopmental, neuro is your brain, right? So the neurodevelopmental are things that may happen in utero or when you're first born, as your brain is developing. Neurodevelopmental. So again, autism, the spectrum, any Down syndrome, what else? And some born with, that's a big thing. Fetal alcohol syndrome, that's a neurodevelopmental disorder. And so if mom drank alcohol and baby is born with FAS, fetal alcohol, that's neurodevelopmental. Okay. So that just means, okay, not necessarily born with, Diana. It can be exposed to early in life because my brain is still developing, right? That's what that means. CP, yes. Okay. When we talk about the neurocognitive and our brain developing, remember that teenagers, our brain develops from the back to the front, right? The front part is reasoning. That doesn't develop until you're about 26 in men and 23 in women. Okay, so if you sit on the question, that's normal human development. That's why, guys, cars insurance is still so high, right? So our parietal lobes are in the back. Okay, so learning to walk and talk and all those things, but the front, that is my decision-making, reasoning skills, right? And they are not fully developed until you're 25. So if you see it as a test question, again, this is normal human behavior. Whenever you see these questions, it's either going to be normal human behavior or it's going to be one of the theorists. Those are the only choices it can be, okay? I said this already. How many stages of moral development according to Kohlberg? Of course, there's 6, right? Got it. Oh, I mentioned, oh, go ahead. Put that one. You hear the mother of a 5-year-old client answer the girl's question about sex as following. Oh no, Nellie, why should someone your age want to know about sex? Now please go play. According to Erickson's stages of psychosocial development, this type of response would directly increase the child's what? Because it is, what's the first term? Initiative versus guilt, right? Kids take initiative and they feel guilty. Okay. Make sure you know this, the order of Kubler-Ross, DABDA, denial, anger, bargaining, depression, and acceptance. DABDA. The theory is that we all go through these stages, that we all don't go in the same order all the time, but the test will ask you the order. DABDA, denial, anger, bargaining, depression, and acceptance. Okay. I am going to... I'm going to pull up my PowerPoint to make sure I cover everything, and then we'll come back and pick up some things. Okay, let me just, so safety first, remember that. Remember, always, always safety first. When you're looking at the questions, you always want to assess before you intervene. We always want to make sure we have all of the questions. Ask questions. We get paid to be nosy. Remember that you always plan with the client, never for the client, and termination starts at the beginning. Our goal is to work our way out of our clients' lives. Okay? Autism spectrum disorder, remember it's the spectrum now. It is not, it used to be called, we had autism and Asperger's. We don't have that anymore. ADHD, in a question, what that might look like and be able to differentiate is, first of all, we're looking at it across environments, right? It has to happen both at home and at school. If the question talks about little Bobby, and he is, can you hear me, guys? Okay. Little Bobby, and he is not acting, he's having issues at school. He's acting out, but he's not getting his homework turned in on time. That is not ADHD. That's going to be probably a learning disability, and that's one of the few times we refer to a psychologist, right? Because in the question, ADD, ADHD must be across environments. It has to happen at home, at school, at church. So if it's not happening all of those places, we need to look at that. And again, if he's not turning his homework in, it's probably going to be a learning disability. I mentioned schizophrenic earlier. There are positive and negative signs. Positive means things that are added. Negative means things that are taken away. Not good or bad, just added. So a schizophrenic should not, no one should have delusions. No one should have hallucinations. So those have been added, right? And then are negative, the things they're missing lack of initiative, reduced speech, they have a flat affect. So those are the things that they're missing. I mentioned that before, right? Those are your time differences. Again, you'll get the PowerPoint. I'm just going to go through some things. I mentioned bipolar 1 and bipolar 2. Cyclothymia. Major depression is 2 weeks. Persistent depressive disorder. GAD is 6 months. Free-floating anxiety, 6 months. Mentioned all of those is OCD. Traumatic stress disorders. Acute stress disorder is 3 days to 3 months. 3 days to 30 days. PTSD starts at the 30th day. Okay, the best treatment for PTSD is EMDR. Okay, EMDR, that is the best treatment. Conversion disorders, if you see those, conversion disorders are neurological issues. Those are under somatoform disorders. So something awful happens, and then I realize that I can't see, I can't walk because of some trauma. These are the substance abuse things that you'll see. Caffeine, you might see it on the test. Caffeine is considered one of the classifications of drugs. You might also see the harm reduction method. Harm reduction talks about, harm reduction suggests that everyone doesn't need to be abstinent, that we teach abstinence, but harm reduction says if a client chooses to use, we're going to honor that and we're going to allow them to use. That means, so if the question is, you've got a mom using the harm reduction method, she wants to go out and party with her friends. My only goal is her kid safe and does she have a way home? It is not leading to, the goal is not to lead to abstinence. I mentioned those, right? There's personality disorders. Pica, that is eating anything that's not food. Enuresis and encopresis are diagnosed at 5. That is when you pee or poop on yourself or pee and poop in inappropriate places. So according to the test, we're not concerned about children being potty trained until they're 4. I know that your mom and him said something different, but that is what we're looking for. A couple of the drugs you'll see, and again, you'll get this, Librium, Xanax, Valium, Klonopin. Those are under my anti-anxiety medications. My benzos, my SSRIs. That's called tardive dyskinesia. That is a side effect of the antipsychotics. That's called tardive dyskinesia. Okay, I'm going to talk about those. We'll use a different book to talk about those. The trans-theoretical model. Remember, this is the stages of change. This was written for drug and alcohol users. However, what we know now is we can use that for anybody. So pre-contemplation, I have no idea whatsoever. Oh my gosh, no idea. Now, contemplation, what you're going to see is the word ambivalence. They're ambivalent, not sure. So the goal, what used to happen there is we would be very forceful and say, you've got a drug problem. Oh my gosh, you're an awful person, blah, blah, blah. Now we use MI. The goal of MI is to really help them look at how their behavior is affecting other people. So then your job, right? How's it affecting your job? Your family, how's it happening? How's it affecting your family? So then the goal then is we're going to, once we get them over the hoop, over the hump of that contemplation or ambivalence, then for preparation, act, and hopefully maintenance. Many times, if they don't maintain, of course, they're going to go back to, they're going to go back. So if they don't maintain, they relapse. Sorry, guys, hold on. Okay, so then if you do relapse, you do not go back to contemplation. You can go to preparation and do a different technique, or you can start the action again. Okay, but you can't go back to pretending that you don't know there's a problem once you've relapsed. Co-occurring disorders, that just means I have 2 disorders at the same time. So if I have the dual diagnosis, that means I have a drug and alcohol problem as well as a substance abuse problem. We used to think we had to treat you differently. We had to get you clean first. We know better now, so we're going to treat you both for the same thing. Anti-abuse, that is considered aversion therapy. Anti-abuse is the patch or the pill that you take that if you drink on it, you will throw up, you will vomit profusely, like projectile vomiting. So aversive therapy is a behavior technique, and the goal of that one is to stop the, of course, stop the behavior. You would stop using anti-abuse when you can then be abstinent by yourself. Okay, Methadone, Suboxone, those are terms that you might see. Those are my opioid ways to treat opioid addiction. Naltrexone, it colors it stops the cravings. Did I go ego defense mechanisms? Okay, I'll come back and pick that up. We'll go over some ego defense mechanisms, seeing what they look like. If you can answer this one for me. A male client is reprimanded at his job by his supervisor. The client arrives home later that day and immediately begins yelling at his children. This is an example of what? And you can yell it out, guys. You don't have to put it in the chat box. What is this an example of?
Reaction.
E.
Oh, it is not reaction. It's the
No, it's D.
displacement. Okay.
It's displacement.
Tell me why, somebody.
Because he's taking his anger from his boss or whatever happened at work and putting it on his family at home.
Exactly. Displacement is the same feeling, wrong place. Safer place, Freud would say.
Right. I just watched this video today. Dang it.
Look at that. Reaction formation is I am forming a reaction totally opposite than how I really feel. Most often the question talks about someone who's gay, they're in love with their roommate, and what they do is they go out and they harass gay people, right? Because they're putting on this big show because they don't want the world to know what's really going on. Okay. Projection. Projection is a difficult one sometimes to understand. Projection is when I am feeling a certain way and I assume that you are too. So for example, with projection, let's say that I got up this morning, right? And I normally get my clothes ready for work, and I didn't get my clothes ready for work this time. Oh my gosh, I'm behind, and I'm doing that self-talk. Pam, you're so stupid. I can't believe you didn't do this. Blah, 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 right? That's how I feel about me. I get to work, and then let's say maybe around lunchtime, I ask, my peer to bring over that case file, and he says, oh my gosh, I forgot it. Let me go back and get it. And I let him have it. What is wrong with you? Why can't you get your act together? You should be prepared for this. You should have gotten up this early this morning and prepared. Projecting my stuff that I don't like about me onto the client, onto the person. Okay.
And all these are defense mechanisms. I remember looking at this video this morning and got that wrong.
Okay. So terms that belong to Freud. I mentioned ego syntonic and ego dystonic, right? So in sync with your ego, those are the things that we're coming to therapy. We're not coming to therapy for because they are in sync with my ego. Those are all of my personality disorders. Also, it is going to be anorexia. Anorexics always think they're too fat. So that is also then going to be ego syntonic, right? So anorexics come many times because they're about to die. Okay. So then my ego syntonic in sync with who I am, ego dystonic, I don't like. We're going to come back and talk about the id, ego, and superego in just a minute. I just want to go over some couple other things. The term ego alien, it means the same thing as ego dystonic. It's uncomfortable with my ego. Some of these terms you'll see as well. I think I mentioned earlier that reflection always means restating the client's feelings, the words they didn't say. Okay, so restatement or paraphrasing, those are both the same thing. So it can also be like relabeling or reframing when we look at those the family theorists. So to paraphrase is to restate it in their own words so they know that I heard them. Clarification means that I understand, right? I'm going to make sure I understand. I can keep asking questions again and again and again to make sure that I really understand what's going on. We can confront clients whenever it is incongruent, what they're saying doesn't match with what they're doing, or the things don't match. Confrontation is okay. Confrontation is always okay with drug and alcohol users, because if their mouth is moving, they're lying, right? Silence is okay. If the question says a little bit of silence, that's good. If it talks about a lot of silence, then I have to do something. Right? We can't sit there for 45 minutes and not say anything for the test. Active listening in general is just, all of these skills are part of active listening. The goal of active listening is I'm sitting here, right? And you know that I'm listening. Everything about my body, my eye contact and my shoulders, everything in lets you know that I'm listening. Active listening doesn't always mean saying anything. This term, paradoxical intent or paradoxical directive, that belongs to strategic family therapy. Strategic family therapy works, that's Haley. And Jay Haley looked at how families communicate with each other. The paradox is the opposite. So what happens is, if I have a client and I've been working with this client, and they come in and they say their teenage daughter keeps going out, breaking curfew, right? I've given them some things to do, lock the door, take her phone, do all these things, right? And they have not done that. I can then use the paradoxical directive or the paradoxical intent. I'm going to say to them, well, you know what? Since you don't think this is a problem, why don't you just go ahead and party with your daughter? In fact, go ahead and buy drugs, right? To hang out with her. The goal is to let the client see that, either you need to do something or get off the pot. I've given you all of these things to do and you haven't done them. So do something or get off the pot. That simple. That term, universalization, that is one of Yalom's curative factors, right? Universalization means that we're not the only one. That is a good term, right, when it comes to group, because we want to feel like we're not the only one. It's not a good term when we are looking at individuals. We don't want to universalize. We want to always be cognizant of diversity. Classical conditioning. Classical conditioning is pairing two things, okay? Before they're paired, that is unconditioned. So the dog, the respondent is something your body does anyway all the time, okay? So the dog, the respondent is what we do. Dogs salivate no matter what. They just do, right? So the body is the you are, right? So the respondent, so it's not conditioned. I hear a whistle, I see something, okay, whatever, dog salivate. Conditioning is when over time I pair these two things together. So my body's natural response is then paired with some stimuli. So that becomes a conditioned response with a conditioned stimuli. We all do that all the time. So you may have a separate phone number, or you may look down at your phone and you see it's your boss calling and you feel some sort of way, right? The boss didn't create that, whether it's anxiety or whatever. You had that already. You've always had that. Now you've just paired it with that call. Most often because the last call or calls before that have been like, oh, not so good. So now you've paired those two things. So classical conditioning is just pairing those two things together. Okay. This one, many people struggle with. Okay. So operant conditioning. Anybody want to be brave and share what that looks like? You can talk now. Nobody? So operant conditioning is the one that many people struggle with. Okay, so what we're looking at is what I hear all the time is when you put your seatbelt in and the noise goes away. What's that called? That's straight from Rosenthal's video. Come on.
Negative reinforcement.
Exactly. It's straight from his video. Okay. So why is it negative reinforcement?
Because something's been taken away.
And
the behavior.
And it what?
increases the behavior.
What behavior does it increase?
Safety, I guess. Did you say putting on a seatbelt or taking off?
So when the Rosenthal's in his CDs, he says that's negative reinforcement, right? You put in the seatbelt, and he says that's negative reinforcement. I'm asking you why it's negative reinforcement.
Because you're well, it's negative is take away. Reinforcement is to increase the behavior. So they're
Okay,
putting on
so
the seatbelt to make sure they don't die in the car, I guess, car accident.
okay, so then the what he really talks about is it's the noise, right? So when I put the seatbelt on, the noise goes away. That's what makes it a
Oh, yeah.
negative reinforcer. It
Right.
goes away. Okay, so that's why the government, you know, them people like to make sure you wear your seatbelt, so they're trying to reinforce the behavior of wearing your seatbelt. They're reinforcing it by taking away that horrible noise if you do what you're supposed to do. Okay. For most of my clients, that's pretty much what you know because you've heard it Rosenthal 1,000 times. So let's kind of look at it to make sure that you really understand it. So behavior, this is a behaviorist term. Remember, all of my behavior, Skinner, Pavlov, all of my behaviorists could care less about how you feel. And we look at the questions, there are no feelings with the behaviorists, right? Change the behavior. Skinner said that we're like people, rewards and consequences, that's all we need. Okay. And I think that's true if we lived in like one of those countries where they chop off your fingers if you steal, our crime rate would go like way down, right? So when we're looking at these questions, if I like the behavior, I'm going to reinforce it. I want it to continue. Right? I'm going to reinforce it. If I don't like it, I'm going to stop it. I'm going to punish it. I'm going to do those by adding or taking away. Adding or taking away is not good or bad. I talked about schizophrenia earlier, right? When we're actually at the things that are added are things that they shouldn't have and the things that they're missing. So when we look at this, don't think good or bad. Think added or taken away. Okay, if I like the behavior, I'm going to reinforce it. If I don't like the behavior, I'm going to punish it. I'm going to stop it. Okay. Okay, so can I get some volunteers? Because a lot of people struggle with this. Be brave, be brave, be brave.
I'll volunteer.
Okay, who's that?
Tarshay.
Tarshay, do I see you? Yes, I see you. Okay, sorry. Okay. Easy one. Number one, Johnny puts his quarter in the vending machine and gets a piece of candy. First of all, I'm going to look at the behavior. He put his quarter in the vending machine. Will he do that again?
Yes.
So that's reinforcement, right? Yeah, I'm going to do it again. Now, why is he going to do it again?
Because he's getting candy out of it.
Okay.
So things added.
So what is that?
Positive reinforcement.
Exactly. Exactly. Okay. Okie dokie. Number 3. Who else?
I'll go because I struggle.
Okay. Thank you. Number 3. You stick your hand in a flame and you get a painful burn.
Okay.
Okay. The behavior, always the behavior first. I stick my hand in the flame. Am I going to do that again?
No.
So that is a
negative.
Nope. Not good or bad. Either I won't do it again. I'm being punished, right?
Right.
That's a punishment. Girl, you stuck your hand on fire before? I'm
No.
a little slow. It might take me twice. I'm a little slow, but it hurts. So, okay, that's a punishment. I'm going to stop. I'm not going to do that anymore.
Okay.
Why am I not going to do it anymore?
Because I received a painful burn.
Okay, that was added. The burn was added. So that makes it positive. Not good or bad, added. So this is a punishment that was added. So what is it?
It is a positive punishment.
Yes. Okay. You've got to change the way we think because we've always heard that punishment is bad, whether we add or take away, right?
Yeah.
Yeah. Abrina, do you have children?
No, but I work. I'm a school counselor.
Okay. So at school, when children don't do what they're supposed to do, what is the punishment? What does it look like at school?
If they do something bad, typically they may get in trouble. So they'll get like in-school suspension or a parent phone call.
Okay, stop there. In-school suspension. So what is that?
Where children have to sit in school.
No, I'm sorry. I know what that is.
Sit in school?
I'm sorry, my bad. I mean, is that a positive punishment, a negative punishment, a positive reinforcement, a negative reinforcement?
Okay. So can I talk through it?
Yes, please.
Okay. So in-school suspension is a reaction, kind of like the person getting burned.
Okay.
It's something that they did.
So, so when people get in-school suspension, is it because they've done something wrong?
Yes.
So that's a punishment, right? We
Yes.
don't want that behavior to continue. We're trying to stop the behavior. That's a punishment. Okay.
Correct.
Now then, so if I'm punished, what are you giving me?
A reinforcement?
No. You're giving me in-school suspension, right?
Right, yeah.
And so if I'm punished, that's a punishment, and you add something to me, you give me something, that is a positive punishment. Okay? Stopping the behavior by adding something.
Okay.
I know, that makes no sense whatsoever. Okay.
Okay.
I know. Okay. So it's a difficult concept, and the best way to learn it is to apply it to real life. It really is. We do this all the time. We really do. Okay. So Abrina, when the kids do a good thing, that's we're going to reinforce their behavior, right?
Okay.
So what happens in your school when they do something really good?
They get to have a movie day.
Oh, yeah, it's a movie day. So I like the behavior, reinforcing. And did I reinforce the behavior by adding something or taking something away?
We added.
So that makes it?
It's a positive reinforcement.
Yes, there you go. Okay. It really is just a matter of retraining. So you do this every day. All of us do. So when you need to put it to everyday language to make it stick, right? My mother told me that spanking was good for me. That's a positive punishment. I don't think that's what she meant, right? I'm thinking add it on makes it a positive punishment. Okay, so I see some.
I have a question.
Go ahead.
Oh, sorry. Okay, quick question. So this kind of happened today. Like the teacher said, my daughter did something, was inappropriate, and she's on this club at school, so she wanted to take her out of the club.
Okay.
Right. So I was like, well, no, I don't want to take her out of the club because that's something that she likes to do. Because I feel like, I think in my mind, I was thinking that was a negative, which the way I was thinking it would be a negative reinforcement because maybe it's just attention seeker. I hadn't talked to her about it yet. So I can relate that.
Okay. So remember, the test is simple.
Okay.
Simple. She got in trouble today and they kicked her out of the club. They took away her membership. What is that? She was not behaving well. So that is, we don't like that behavior. So that is
punishment.
Exactly. And we punished her by taking her out of the club. That is
says negative punishment.
Yes.
There's hope after all.
Yes. Okay.
Oh my gosh. Okay.
But we do it all the time. Put the verbiage to it every day. It makes it so much easier. Okay. So go ahead.
So when we talk about, we go back to the coin, the first question that Johnny puts a quarter in the vending machine, candy. So it's a positive reinforcement, but at the same time, like this is my confusion here in this one. Like he's losing something too. So he does not have the
What's
coin.
he losing?
Like he lost the coin. So he doesn't have the coin. So he's
okay. You're thinking. Don't think, read. Okay. Don't think. And I say it to everybody, not just you. Because what happens is we're counselors. We go all the way around the woods and like 17 steps and grandma lives across the street. You got to turn that off. Okay. So all that matters is what's in this line. He puts his quarter in the vending machine, right?
Yeah.
Will he do it again?
Yeah, because he gets his.
That's it. It's really that simple. Okay. Don't add anything more. And not this question any of the questions, turn off your thinking cap. I know that sounds silly. Leave your brain at the door. All I need you to do is read. All right, because what happens is we can think, but in my office or last time I heard this, or no, just read. Just read. Okay. Okay, so let's see here. Number 3, who I did that one already. 4, somebody?
Can you clarify real quickly and give us an example of what a negative reinforcement is?
Allison?
Yes.
Let's do some questions since you're there. Okay.
Okay.
Let's see here. I don't want to give them away, so let's just go through some questions, okay? Look at number 4. Bobby fights with his sister and doesn't get to watch TV at night. Okay, so what is that?
That would be a negative punishment.
Tell me why.
Because you're taking something away from them.
Okay, because I don't like the fighting, right?
Uh-huh.
Okay, perfect. Okay, look at number 7. You take an aspirin to eliminate a headache. What is that one?
Okay, so yeah, that would be a negative reinforcement, right?
Explain it to me.
Because you're taking something. Oh wait, no, that's added. Sorry.
Hold on. No. So you take an aspirin to eliminate a headache. What's the behavior?
Taking an aspirin.
Okay, so that's reinforcement, right?
Uh-huh.
Okay, I'm taking an aspirin, and what goes away?
The headache.
So that is?
So it's taking away.
The headache goes away.
Yeah.
That's what makes it negative reinforcement. I'm reinforcing the behavior because I want that to go away. Does that make sense?
Yes, thank you.
Allison, if you went to work like 4 days next week and on Friday your boss said, yo, girl, you don't have to come in on Friday and I'll pay you. What is that?
Probably negative reinforcement.
Exactly. I'm going to do it again, right? I'm going to work hard the week after too, because I'm hoping he takes the day away. So he reinforced my behavior by taking away something I didn't want to do anyway.
Okay.
Okay. So now let's take that back to the seatbelt thing. So then how is that negative reinforcement? What did I take away?
The noise.
Mm-hmm. But I like the behavior. Okay. Does that help a little bit?
Yes, totally. Thank you.
Okay. So what I normally say is, and if you've seen my videos before, so if you're married, you got a spouse, significant other, you come home from work and they have made dinner and they never make dinner and there's dinner. It's amazing. Oh my gosh. It's like, I don't care where they caught it from. They may have cooked it, but it's amazing, right? Got dinner, really good. If I like it, right? So what would be a positive reinforcement? What would I give them?
6.
That's right. I'm gonna give them sex, exactly. That's why I'm single, I guess. But I'm gonna give them something. A kiss, a hug, or something, a trip upstairs. I will give them something. That's a positive reinforcement. Same sort of thing now. You come home and the dinner is made and it's amazing and you're so happy. So what would a negative reinforcement be?
Telling him that you'll clean the dishes.
That's it. Okay. Have you been watching videos? Or do you just really know that? Okay. That's a Pam Turner question. Okay. So the goal is that you're removing something that he doesn't like or she doesn't like anyway. Okay. So when you're looking at the questions, remember it's do I like the behavior? And if I like the behavior, I'm going to add. If I don't like the behavior, if I do like it, I'm going to reinforce it by adding or taking away. Let's see. Who wants to do another one? Anybody? Raise your hand.
I want to do one.
I see Jessica. Jessica, let's do number 9. Nathan tells a good joke and his friends all laugh.
Nathan tells a good joke and his friends all laugh. So he did something. Nathan tells a good joke and all his friends laugh. So the behavior is,
will he do that behavior again?
Yes, because it had a positive.
Okay, so if he'll do it again, we're reinforcing it, right? We like it.
So it's a positive reinforcement?
Yes, it is. Yes, yes, yes. There you go. There you go. Okay. Somebody else? Somebody said something. Desiree, was it you?
No, it was me.
Me, Kiara. You have to turn your camera on, girl.
Oh, it was me too. Yeah.
There we go. There we go. Let me see that face. Okay. So, number 10. You climb on the railing of a balcony and you fall.
It's a punishment.
Okay. And it is a?
You won't do it again, so it's a positive?
What's added?
You fell off the balcony.
Exactly. Positive punishment. I'm sorry. So positive, yeah. I won't do that again. Punishment. And because the fall was added, positive punishment.
Yeah.
Okay. We get that, guys? Because that people struggle with that. Are we better? Yes.
Dr. Pam, I'm struggling
hold on. I don't know. It's PTOSON. What is your name? You're muted. You're muted.
Pamela.
Great name. Ooh, okay. So I don't know that you understand this.
I wasn't getting it, kind of.
Yeah, I can tell.
I don't either.
It's like, I don't know. Thank you for admitting that, okay?
Yeah.
So if you want to say something, I'm a therapist, really. I can see your face. Okay, so, Pamela, let's look at number 17.
Okay.
A rat presses a lever and gets a shock. The first thing I'm going to understand is the behavior. His behavior is he presses the lever and he gets a shock. Will he press the lever again?
No.
So that's punishment, right? We don't, if I'm trying to stop the behavior, it's punishment.
Okay.
Why won't he do it again?
Because he got shocked.
So was that something added or taken away?
Taken away. I'm not sure. Added or taken away. I'm trying to get that.
I wish I could reach you. If I shocked you with my taser gun.
Added.
Thank you. Okay.
Thought about it.
Thank you. Okay. I do have one. I can't reach her from here, but it's added. So then that is a positive what? He won't do it again, will he?
No.
So it's a punishment.
Oh, so it's a positive punishment?
Yes, it is. You're like, what the heck? It's not good or bad. It's adding, right? Adding. Okay. So if every time you miss the question, I could like shoot you with my taser gun, would that be positive or negative punishment?
That would be negative.
Nope.
Oh.
I'm adding something, right? If every time you miss the question, I shot you.
Oh, so it would be positive.
Exactly. I'm adding, right? I'm adding that shoot. Exactly.
Right.
And punisher, right? You'd be getting them questions right if I shocked you every time, right?
Of course. Yeah.
Exactly. Okay. Positive punishment. That's what that
positive
looks
punishment.
Like. Okay.
It just sounds so crazy.
I know. So remember, not good or bad, added or taken away. Okay. Carla, I see your hand. You want to do one, right?
Yeah, I'm struggling.
Okay.
I want to go back to 10. So the climbing and falling off the balcony.
Okay.
Just want to make sure I'm understanding. So the behavior is climbing and falling.
Got it. So the behavior is climbing.
Okay.
And then what is added?
The fall.
So then, will I climb again?
No. So it's positive punishment?
Yes.
Oh, Lord.
Something was added to stop the behavior.
To stop the behavior.
Okay.
Question.
Okay.
Who's that? Who?
Is Tashanti speaking?
Yes, go ahead. I see you.
So just trying to get an understanding of the positive punishment. It makes sense. But for some reason, I'm thinking of like a natural consequence, something you won't do again that caused.
Does this test ask you about natural consequences?
No, but I
Okay,
still
so you
trying to
know.
understand. So that's what's coming to me for me to understand
Okay.
the positive.
Okay. So okay. To me, I have children, right? You leave your bicycle outside and it gets stolen. That's a natural consequence, right?
Yeah.
Okay. So what is that?
What do you mean?
Is that a positive reinforcement, negative reinforcement, positive punishment, negative punishment? What is that? I left my bicycle outside and it got stolen.
Well, I would say a negative punishment.
Because?
Come
on, you're right. Just tell me why.
Because you left your bike outside.
No, negative is not good or bad. Negative is added or taken away. What was taken away?
Your bike.
Exactly, right? So then it's a punishment. I won't do it again, right? Because I lost something. My bike was taken away.
Okay.
That makes sense?
Yes.
What we have to do is erase that added and the good or bad. It's not good or bad. Remember elementary school? Pluses and minuses. What was added, what was taken away. Okay?
Dr.
I
Pam,
know. It sounds like a foreign language.
can you do number 8? Because there's a lot of good and bad taken away adding the number 8.
Yes. Okay. So you're on, girl.
Okay.
You walk the dog to avoid having the dog poop in the house. Okay. What's the behavior?
Walking the dog.
Okay. Is that punishment or do I want to stop the behavior or keep the behavior?
You want to stop the behavior from
Not
him
walking
pooping.
the dog. I want to stop him from pooping, right?
Yes. Yes.
Okay. Then, so I will walk the dog.
So that's positive.
Okay. No, that's that I like so do I like the behavior or not like the behavior? He pooped in the house.
No. So the behavior is pooping in the house. You don't want that. You don't want pooping.
Okay. So I'm going to try to stop it. I'm going to punish the behavior.
So you're punishing the behavior and you're adding something, which
What
is
am I
the
adding?
walk. The walk.
Exactly.
So that's a positive punishment.
You got it. You got it. You got it.
Okay. That's so hard to get your brain around.
I know. Look at the behavior and then decide if it's adding or taking away. Do I want to stop it or do I want to keep it?
Okay. Thank you.
So all of you that have kids and you bought your kids electronics, you only bought them so you could take them away, right? Maybe it's just me, okay, but that's why. Yes, you can have a PlayStation 17 because it's mine when you misbehave, right? So that is negative punishment. I'm taking away something they like to do. Okay. You really have to, and I have a short on this. You have to just go back and watch it over and over again. Repetition is the key. So this is CBT. I'm doing cognitive restructuring. I'm suggesting that the way that you've been thinking before was faulty, right? And I want you to change the way you think. So I'm restructuring your thinking process. And the way we do that is repetition over and over and over again. You do this every day. Just put the words to what you do. So if you're working with a client and the client's having trouble with their child, then you might say, well, have you decided to do some positive punishment, right? Give them extra homework, adding stuff to them. One of my clients said one time that if his kids misbehave, he'd make them eat broccoli, right? That's still a positive punishment. You're adding on the broccoli. It's because you don't like the behavior. Okay? I know it's a difficult concept. I do know that. I have a video. Go back and watch it over and over and over again. Okay? I really want to get into my theorists because that is the biggest part of the test, whether it's in group or anything else. I've got to know my theorist. Okay. I'm looking for the terms that belong to my theorist. Okay. So Skinner and Pavlov are my behavioral theorists, right? That they both say that I can stop behavior by adding or taking away something. Okay. Extinction Extinction happens by removing the reward, removing the reinforcement. Okay. So let's see here. Christina Smith. Girl, you at the beach? Just saying. Okay, so Christina, you go to work because you get paid, right?
Yes.
If you didn't get paid this week, what would happen?
I wouldn't want to go to work.
You'd be extinct, right? Where's Christina? Anybody seen her? Right? Like animals are extinct. So to extinction, stop the behavior, is by removing the reinforcement. I like y'all, but you ain't gonna pay me. I ain't gonna show up. Okay, so extinction is going to stop the behavior by removing the reinforcement. Does that make sense?
Mm-hmm.
Okay. So then while we're there, let's go a couple of things. So systematic desensitization, that's Joseph Wolpe. He talked about phobias. So systematic desensitization is teaching you to handle your phobias. It's slowly, right? If you're afraid of heights, the first thing we're going to do is go to the first floor, right? Anxiety is going to rise, it's going to stop. We're going to come back down. Next time, third floor. Next time, whatever. Systematic desensitization will pay. Flooding is if you're afraid of heights and I put you in an elevator and I push the 97th floor and you just go all the way up. Right? You didn't die, you're good. That's flooding. That's all at the same time. So the way I remember flooding and the way I teach it is when my kids did swim lessons, they knew how to swim, but they're afraid to get in, right? And the swim instructor would just push them in, right? They knew how to swim. Don't be calling defects on me. They knew how to swim, okay? I just didn't push them in and they're grown now. That's flooding, all at the same time. The other term is implosion. Implosion is then I am doing it all at the same time, right? But I'm imagining it. Close your eyes. Pretend that you're in an airplane. It's really high, right? You can look down and see the people that look like ants. That's implosion. It's flooding, but in my head. Okay. Okay. I got to get to my theorists because those are the most important people. These terms I talked about, emic and etic. Emic is seeing the world from the client's viewpoint. Okay. So then I want to see from how they see the world. Etic is universal. Etic says, well, we're all humans. We're all the same. We're not. Sorry, we're not. So the way that I remember etic is, and it might be a Rosenthal thing. Etic, I think of etiquette, right? So in my house, when you come to my house, you get a fork and a knife and we're good, right? That's the etiquette in my house, right? If I go to someone else's house who maybe happens to be of Asian descent and they eat their rice with their fingers, I'm like, oh my gosh, that's so gross. How can you do that? Because I'm looking at it from my view, right? That's not okay in my view. That's not how we work. That's not okay. What I want is the emic view. I want to go to their house and realize that they eat with their fingers, right? And that's normal. I want to see it from their viewpoint, not my viewpoint. We don't use that term, the melting pot, anymore. We don't use that. We don't want it to be a melting pot, right? It's not okay. People say, I don't see color. Not okay. We want to see color. We want to celebrate culture. We want it to be different. So the term we use now is a salad bowl, right? I want my greens to be, well, I don't really like iceberg. So if you like iceberg, crunchy, right? So I don't like iceberg, but I want it to be crunchy and I want to have tomatoes that are juicy and sweet, and whatever else you add has its own unique flavor. That's what makes the salad so good. So that's when we look at a salad, but we want to always come from the client's point of view. And when we look at that, what's my train of thought? Looking at it from the client's point of view is emic. Oh, so Gilbert Wren, culture encapsulation. You might see that also in the same kind of question. Culture encapsulation is when you see it from your little capsule. Right? I say, like, if you see it from, you've got that toilet paper tube, right? And then that's all you see. I don't understand why those people over there behave that way, because I can only see it from my viewpoint, right? So we don't want that. Culture encapsulation means I only see it from my viewpoint. The question about diversity, the first thing you always want to do is make sure that you check yourself, okay? We all have biases. Let's not pretend. My biases just cannot get in the way of what I'm doing, okay? So make sure we check ourselves first, okay? These terms, make sure you know these. These are under my LGBT as well. Cisgender means that what I have between my legs matches how I identify myself. I've got a vagina and I believe I'm a woman. That's cisgender. It matches. Okay. Gender dysphoria, that is the DSM term, that means I'm unhappy with the gender that I was assigned. I have a penis, they call me a boy, but I believe I'm a girl. Unhappy, so euphoria means happiness. Dysphoria means unhappiness. I'm unhappy with the gender that I was assigned at birth. Okay. So the medical profession says that gender dysphoria should not be in the DSM. The term intersex, it used to be hermaphrodite. That's not an appropriate word anymore. Intersex means people that were born with both parts, right? I was born with more testosterone or more estrogen, more of the female, more of the male. So I may be born with penis and breast. That's happened forever. It's not a new term. We called it hermaphrodite, right? That's still the term for it. So now it's called intersex, and I'm born with it's not all complete. It's not all clear that I'm male or female. Remember, gender is boy, girl, or non-binary. Non-binary means I'm not labeling myself or boy or girl. That would mean they. Somebody earlier had their pronouns. I saw she and her. Okay. So she and her means that I identify as female. Okay. So if it says they, that means I don't identify either way. I'm non-binary. That also might be seen as the X. X means, again, I'm not identifying as male or female. That is gender. That is not sexual orientation. That is just what I have between my legs. Gender. So cisgender, gender fluid. Gender fluid means that, sometimes I'm more female, sometimes I'm more male. Okay. That is gender fluidity. Okay. Your pronouns, again, like I said. So they, didn't talk about it. So he, she, or they, that's what you're looking for. So your sexual orientation is who you choose to sleep with, not what you have between your legs. Okay, that's your gender. So if I'm gay, straight, or gay, straight, or gay, straight, or somewhere, bisexual, or what's it called? Pansexual, right? That means I pansexual, most people say that I fall in love with the trait. I choose to sleep with something about you. I like smart people. I like tall people. I like people with green eyes. It doesn't matter if you're boy, girl, or non-binary. That's who I'm attracted to. Okay? So those are those terms, and you'll get a handout on that as well, guys. Okay, I just got to get to my theorist, because that is the one of the meats and the words to look for, what you're looking for in the question. I'll probably go to about 8:30, so if you need to leave, I understand. And do know that it's recorded, so as long as you put an email, you have to put an email, you have to email Prudence, drpam2020@gmail.com. You have to email Prudence. Prudence is my director of operations. So email her. That's probably how you got here most often. And then be sure that you put in the chat box, in the heading, that you are in the NCE group and what date it is, right? Because I do many different groups, many different days. Okay, so let's start off with Freud. Okay, so the goal of Freud was to bring the unconscious to the conscious. What he believed is most of our stuff was unconscious, right? Remember, it's called topography, right? Where everything is unconscious, right? The goal is to bring things from the unconscious to the conscious. So then the tools he used would be my thematic appreciation. You might see that. You might also see the CAT, which is the child's appreciation test. Okay, they're the black and white pictures. And Freud would ask you what you saw. He would say, what's happening in this picture, right? So he said the problem was that everything was hidden, and he used this picture as well as the ink blot to bring things back up to the top. Okay. Pamela, what do you think is happening in this picture? Come on. There's no wrong answer. They're projecting from your unconscious, and subjective, because no matter what you say, Freud would say that you're wrong. What's happening? You're muted.
He's ignoring her. Maybe he just got through having sex with her, or getting dressed and leaving, or whatever.
Okay. Somebody else. Christina at the beach. What do you think's happening in this picture?
Looks like he's trying to cover his face, like he doesn't want to see something, or maybe he's tired, stretching, just getting up and getting ready to leave.
Okay. The man. What is your name? Dame, D-A-M-E-D. What is your name?
It's Demetrius.
Demetrius, how are you?
How you doing, Pam?
I'm great. So what's happening in this picture?
It looks like she's partially nude, so he's covering up his face to avoid looking at her.
Very good. Anybody else?
I see something very different.
What do you see?
I do. I see something different.
I see maybe as if she's deceased or very ill, and he's sobbing or trying not to look.
What's that term? When you have sex with dead bodies? What's that? Necrophilia, yes. Is that what you're suggesting then, Jessica?
I mean, that could be a possibility.
Okay. So, anybody else?
Yeah, I see the same.
I was gonna say that.
Okay, is Yvette?
Yvette, yeah.
Okay, go ahead. What do you see?
My first impression was like he's sad because she's dead.
Gotcha. And somebody else, one more?
I was gonna say that she's dead, and he probably killed her and feels bad about it.
Okay. There's no right or wrong answer. Freud would just say, he said, whatever you're seeing in the picture, you're projecting from your unconscious onto the picture. And it's subjective, so it's his opinion. So Freud was the expert, and no matter what you said, he would say, well, no, that's not right. Right? Or this is what it really means, because he was the expert. Okay. So in Freudian, the goal is to bring the unconscious to the conscious. Okay. So then in this picture, I'm going to tell you, I do this like 17,000 times a day. This is what I see. Do you see that her nipples are hard? She enjoyed it, okay? She enjoyed it. And he's like, oh, that was tough. Okay, so just saying. So again,
Is his clothes still on?
Well, he's done. He's tired now. Like, oh my God, took a lot to please her.
But his tie is still looks like it's tied.
Okay, maybe he just took his pants down.
Well,
I don't know. Okay,
He just got dressed. He's done.
There's no right. Go
I
ahead.
kind of thought that too.
Yeah, look, she enjoyed that. Ooh, she went to sleep. That was great. So, again, whatever you bring into the picture, Freud would say is in your unconscious. So he would say that's what's really going on. There's no wrong or right answer. Subjective means it's opinion. Objective are facts. Subjective, it's his opinion. So he would use the TAT. I don't think you'll forget this now. Thematic appreciation test. You're looking at the theme, and you're looking at your perception of the theme. Okay, you might use the CAT, and some people still use that in practice. So that's the perception, but they're child pictures, children pictures. Okay, the other thing he used would be the Rorschach, which is the same as the ink blot. You can't use Wikipedia for anything at school, but it's always got a great picture. Okay, so this is the ink blot. Same sort of thing. He would ask you what you see in the picture. And what you see, again, is projected from your unconscious because you don't remember that stuff. And he said that's where the problem lies because you don't remember what's in your unconscious. Okay, so again, whatever you see in the picture, that is what he would, again, subjective as well as projective, projecting from your unconscious. Okay. So he is my Freudian guy. So what you'll see afterwards is you will see people that are neo-Freudians. Okay, neo-Freudians means that they believed in the unconscious. They just did not believe in the other things. They did not believe in the id and the super ego. Okay. I was really going to hang with you guys for a minute, but I have got to go to the bathroom. So give me like 5. And if you have to go, I understand. If you want to hang with me for a little bit, that's okay too. Okay. Again, to get the video, drpam2020@gmail.com. And Prudence usually gets it out. She probably won't get it out till tomorrow, to be honest, but you'll get it. Okay. Okay. If you do have to leave, I really do understand, and I want to thank you for hanging with me. If you need to, can you hear me okay? Okay. So I just want to thank you for hanging with me if you have to leave. So we're going to go back and do just a couple of, I really want to pick up the theorists and talk about those things. Any questions for anyone who has to leave that doesn't include what I'm going through next? And again, it is recorded. You'll get a recording of this and all the material I use, plus the practice test.
I have one question.
Yes.
It's regarding the day of the exam. Is there anything we're supposed to take? Because I know when I did my CPCE exam, I had to take my login information for Pearson. They asked us to write it down on a piece of paper and bring that only, and a pen or pencil for taking notes if they provided us paper. So I wanted to ask if it was the same with the NCE exam.
Anybody want to answer that?
They do ask you for your ID. Sorry. They do ask you for your ID, and you're gonna have your login information, just to make sure that they check everything, that make sure that you are you, that you are who you say you are. You're gonna need that when you get in. I don't know if you're gonna do it in person or online.
I'm doing it in person.
Okay. But you do need your ID. I think they ask for that.
You need 2 IDs.
2.
Yes.
Okay.
Okay. So those who've taken the test, what did you use? Are they both picture IDs?
I use my social security card and my license.
So only one has to be a picture ID.
Right.
Yes.
Okay. Well, somebody asked me earlier, will a credit card work?
No.
Will a school ID work?
No.
A
They
school
told
ID
me
won't
no.
work. Oh.
No, but I'm in NC, so I don't know what's for you. But at my center, they said it had to be like social security card, and like a government issued card or license.
Your driver license.
And I'm in Wisconsin. And when at our site, for some reason, they just let me use like my debit card and my ID both times.
I was going to say, so it's supposed to be the same across all places. So one has to be government issued and the other does not. That's the way it's supposed to be. So you should have and most often your school ID works on top of your driver's license or your passport or something else.
I'll definitely give them a call then, just to be sure, so I don't have anything missing then. Thank you.
I think it's in the handbook. You're supposed to read the handbook.
Margie, I haven't heard from you all night.
It's because I've been listening.
Thanks for sharing.
You haven't felt the need to speak.
Really, thanks for sharing. Much appreciated. Okay, guys, so we're gonna try to wrap it up. So I have dinner plans at 9, and my friend always makes them at 9, so I will finish up, because if not, I would talk all night, because I really like what I do. I hope it shows. I just think that this field is amazing, and I do thank you for doing what you do. I think it's amazing. I just want to go back and cover the theorists, but I think because we're running out of time, I'm going to cover the theorists through test questions. And that's probably a really good way to see kind of what it looks like in a question.
I will say this is the best 4-hour lecture I've had that I haven't wanted to run from.
Exactly. Yes.
I'm just gonna say, I think I'm just a little more interesting than Rosenthal. I just need to put that out there.
Oh yes, ma'am.
I've tried the videos and I just
Yes, his voice and the
sleep.
CDs are horrible.
So, yes, okay.
Yeah.
So, okay. Let me do this one.
While you're looking for that, I need to sign up for the next 5 sessions. But do I go through your shopping website and just do them all, or is there
or send an email to TRPAM 2020? So Prudence runs my business. To be very honest with you, all I want to do is teach. All I want to do is teach. So I've put the things in place so I get to do what I want to do. I still work a full-time job. I still teach college full-time because I need the benefits. I've got 2 kids that are still on my insurance, so I will stay there until that last one finishes college. But really, if it were up to me, I'd teach all day. That's really what I love to do. I think this is exciting.
It is.
And truly, I think this sheet of paper I'm recorded, so I'm going to keep it to myself. But so, yes, go ahead, ask me a question.
I signed up for the one-on-one coaching because my test is May 2nd. Do you think I'll be able to get in the
Not with me.
Oh,
I've got several other coaches you can get in
Okay.
with, but probably not with me. I'm sorry. I have like about an 8-week waiting list.
Oh, thanks for saying that.
yeah, because
Sorry.
I was gonna sign up with you too.
Me too.
So my other coaches I have trained. They teach the way that I teach. Okay. I would not hire anybody that does not teach the way that I teach. Everybody has different personality. So, everyone is not going to be like my personality, thank God. But they definitely, I have trained them personally, and I would not trust any of my clients with someone that I hadn't trained personally. So trust my coaches. They're really, really good. They are, I promise you.
Dr. Pam,
Thanks.
do you
Yes.
suggest the individual session if the exam is in less than a month? Because I know you said typically 90 days, but my test is May 4th.
Kiara?
Yes, ma'am.
Okay. So we started at the beginning, right? And you were doing really well. Are you finding that maybe there are things you don't know? Is that where we're at?
I just know like the research and assessment, like the Z-scores, T-scores, stuff like that.
So we have, so you'll get the video for that tonight because I didn't cover it. But we do have a tutor that specializes just in research and development. I mean, so research and assessment. That's all she does. And there's not a waiting list for hers. So if you really need the hands-on with research and you can get in with her like ASAP. She's really good about that. Again, I just have a waiting list, and I do apologize. So
can I get her name?
Send an email to Prudence, and she'll take care of it.
Okay, thank you.
Okay, yeah. And if you go on our website, you will see the names of all the other coaches and what they're special.
Okay.
Okie dokie. So let's go and look at some questions. So I want to just kind of put these to questions as I cover content. A couple of ones I want to make sure that you know. Narrative therapy, the words I'm looking for is to change your story. Narrative therapy says that we've got this story in our head that we've been telling ourselves over and over and over again. Where we got it from, who knows, but we keep telling ourselves this story. The goal is to externalize that, take it out of our head, deconstruct it, take it apart, rewrite it, put it back in my head. Narrative therapy, changing that story, but you're going to see those words to take it out. Okay. Feminist therapy, you might also see gender fair. Okay. Feminist therapy is not just for women anymore. It was written for women, but it's not. It's for anyone who is marginalized. Feminist therapy says that that what is personal is political. So if a client comes in to see you, right, and they're suffering from depression, what that means from a gender fair or feminist therapist is looking at the political, looking at the environment. If you're the only person of color that is in your office, yeah, you're depressed, right? So that is what feminist therapy looks like. So it was written for women, but not for women anymore. Okay. So Lazarus is my basic ID. Lazarus says that we're going to treat you with your preferred modality. Okay. So then your preferred modality is what you present. So he is an eclectic person. He doesn't have his own theory. So he does not have his own theory. So the way that you present is the way that he's going to treat you. So basic, behavior, affect, your sensation, imagery, cognition, interpersonal, and then the drugs is not necessarily drugs, it's physical, right? Any physical thing that's going on. So then the same thing, if I present with depression, if I present it like I can't get out of bed, if I present it behaviorally, he's going to treat me behaviorally. If I present it as a mood, I feel sad all the time, right? That's my mood. He's going to treat it as a mood. So preferred modality means however the client presents to you, that's how we treat. It's not a new theory. He takes everybody else's theories. That means eclectic. And then you treat them the way that they present. Okay? So under cognitions, he uses the word bibliotherapy. So cognitions, CBT, changing the way that you think, your thought process. So the word bibliotherapy means book. He's giving you a book to read. Okay? Not the Bible, unless you're a Christian therapist, which is okay too. I'm just going to say for the test, bibliotherapy means giving a client a book. When I was doing practice, I'm old. Women are from men are from Mars, women are from Venus. I used to use that book in therapy many years ago. The love languages book, right? Those are things that we still use, and that's bibliotherapy. Okay. I'm going to send you a video on careers because we didn't get to careers today, and that's a huge part of it, knowing Super and Holland and Godfreyson and all of those things. So you'll get a separate video, and it'll be like this, like me talking. So you'll get a video on that as well. I just can't cover everything in 4 hours. But you will get everything that is on the test. That is my goal, is to make sure you understand. Most of my clients have tons and tons of material. The material is not the problem. What the problem is understanding the material. Okay. So again, if you're first meeting with me, I have a website. I have about 100 videos. They are, if it says social work or even like the EPPP, the content is the same. Okay, so if it says DSM, it's DSM. It doesn't matter who it's for, it's DSM. I strongly suggest that I be in your head. That is my goal in life, is to be in your head. When you're taking the test, you've heard me say over and over again that, we went over operant conditioning, right? You know what to look for when you see Freud. So Carl Jung, he did the MBTI, right? The Myers-Briggs, that's the personality test, the 16 personalities. That's the only time we'll see him on the test. He believed in collective unconsciousness. What he said is, like Freud said, it was unconscious, but Carl Jung said, it's not just my unconscious, it's all that my family and my people and all that stuff that I'm bringing in with me. Okay. So I'm going to wrap it up with really just doing some questions. So let's go through and just kind of see what it looks like so I can help you understand what it looks like in a question. Okay. Can you see number 6? Am I sharing? Okay. On a college campus, a group of minority students who've been protesting. If you've seen this test, please don't answer, okay? And don't answer until I say so. Makes my life easier. On a college campus, a group of minority students who've been testing their treatment alluding to harassing comments by whites and what they believe to be discrimination in the grading system by their professors. 11 of the students have come to the campus counseling center and want to begin a group experience to arrive at some answers and find solutions. The most appropriate theoretical orientation of the counselor assigned to lead the group is what? Before you answer, okay, the question is asking me the most appropriate orientation for the counselor to lead the group. So what that means is everything before here, so it says 11, none of that really counts because it's only asking me about the group, right? 11 of the students. So what is the theoretical orientation in the group, right? Do you see the other stuff that's fluff? Because the question asks me only about the group. So that, and hint, it tells me in the question, they want to arrive at answers and find solutions. That is the hint. So then, in my chat box, give me some answers, guys. You can answer now, by the way. Client-centered is Carl Rogers. Words I'm looking for: genuine, right? Not congruent, unconditional positive regard. The client is the expert. He did not treat. He did not diagnose. So Carl Rogers came along after the Freudians purposely to say the client's the expert. Okay, so that was his plan. So Gestalt is whole, means a whole person, here and now. I should be looking for those words or the empty chair. Okay. My answer is A.
Oh.
What? Oh my God. What? So, because
Behavioral.
they only want to have some answers and find solutions. Behaviorists don't care what happened before. They just want to change behavior. Okay, so that's why A is my answer. B, psychoanalytic, I would have been looking for something unconscious in the question, right?
Right.
Behavioral is not cognitive, Sharika. CBT is changing your thought process, and that will change your behavior. But Skinner, Pavlov, Thorndike is the law of effect. What Thorndike said is if we want to change behavior, then the consequences need to happen right with the behavior, right? That's Thorndike, the law of effect. So CBT is a Beck's depression scale, Beck's anxiety scale, not the same as pure behavioral. Okay, so let's just make sure that's clear. Behavioral is not cognitive. CBT is cognitive. Okay.
I can't hear. See.
Okay, can I ask a question real quick?
Yes, hold on. Somebody said you can't hear or see. Am
I
I sharing
can't.
my
Well, I
screen?
can hear, but I can't see mine. I don't know what happened to mine.
Am I sharing my screen, guys? Yes, no?
I think it might be my computer, but I can still hear you. It's okay.
Okay. Okay, so somebody, is it Jacqueline?
No, it's Pamela. I can
Pamela.
hear you.
No. Okay.
Oh, okay.
I got you. Jacqueline, if you want to talk to me, you have to turn on your camera. Thank you very much, girl. Look at you. Okay. So ask me a question.
Yes, ma'am. So the reason why I chose, if we can go back to that question,
we can.
Psychoanalytic, and I guess this was my understanding, there was a question similar to that, and it said working with multicultural, and working with multicultural clients and group prefer psychoanalytic.
So you are absolutely right. So multicultural clients prefer directive therapy. They want to use the model approach, right? You come in, you tell me what to do, and that's a Freudian approach. You're absolutely right. Absolutely. Where in the question do you see anything about multicultural?
You got it. Okay.
Okay. Did I see that word? Did I miss it?
Did not.
Oh, okay. Just checking, right? It's a reading test. It's a reading test.
Reading test.
Do not bring in anything from a past test, a past question. All you know, which is in those lines right there. That's all that matters. Okay. But you're absolutely right, Jacqueline. But you would have missed the question because you were thinking and not reading.
Bam. Okay.
Thinking is not allowed on the test.
To her credit, the word minority students and harassing comments by white give the impression of a different culture.
It's a reading test. If it said diversity clients prefer, then that's how you would answer, right?
Right.
Yes.
I'm just saying, okay?
Okay.
Don't
You are.
Don't think. I know
Dr.
that
Pam.
sounds so bizarre, but
Dr.
don't
Pam.
think. Yes.
May I ask a question?
You may.
All right. Whose behavior are they trying to change? That was my question.
What's the question?
So the question is 11 of the students.
No. Remember what I said to you. All that matters is happening in the group. The most appropriate theoretical orientation of the counselor. What have they come to the counselor for?
They want to arrive at some answers and find solutions.
That's it.
Okay. Don't read any further.
That's all I got, right? That's all it says.
Okay.
Right.
It's a reading test, guys. And I promise you, if you learn to read and not think, it sounds so bizarre, right? But I promise
it is bizarre.
It's a reading test. And that's what happens. People who have graduated from college, like last week, my people that have never worked, you'll do great on the test. because you don't have any real world experience to bring to it. Because
I'm
in
in
the real
trouble.
world, well, you can learn how to read, girl. You can learn how to read, I promise you. Okay. So, okay. So does that make sense of how we get there? Okay. That's part of answering the question. All it asks me, right, is the most theoretical, appropriate orientation. And I do know, right, they want to arrive at answers and find solutions.
Right.
Psychoanalytic, I look for insights, right? We want to look inside and wonder why people may be prejudiced. It doesn't ask me that, right?
Right.
Stay in
You're
the
right.
question. Stay in the question. Okay. I just want to know and you'll see this in the video with research and assessment. That term ipsatively just means I only measure against myself. Okay. In the real world, there's this big old thing out there. I am 56. I am 5'9". It says how much I should weigh, right? There's this big old norm, right? Those are the norms. I don't really care what that says. What I care about is, do I weigh more or less than I stepped on the scale yesterday? I'm only comparing to me. That's ipsatively, that's what that means, okay? So 13, you might see this question on the test as well. Historically, there were many influences on the development of the testing movement. Which one is not an influence? And on the test, the not is not, it's not bolded like this, right? So 3 of these are things that affected the early testing movement. I'm going to tell you, it's not A. Thank you, Carla. Not A, not A, not A, not A. Okay, so most of our advances have happened because of the military. Actually, after World War I, right, we came back, and that is where we actually what's his name, Parsons started the vocational, like the father of vocation. That's where that started. After the Russians beat us to the moon, that's where the ASVAB came in, right? The Army test, it looks at your aptitude. Your aptitude is your ability, right? Your potential for ability. That's where that came in. So please know it's only about the military, okay? Number 14, gender role, okay? Gender role is just the role that you've been taught what I'm sorry, the answer to 13 was A. Okay, it was A because it's a not question. Okay, so 14, gender roles. Gender roles are based on society. That means that it's a construct. A construct is something we can't touch or feel, right? Constructivist therapy, constructivist, that term, those are things that we decide as society. Gender roles are what boys or girls do based on their gender. So when it comes to career theory, remember that is Godfrey's son. She talked about circumscription and compromise, the way that we were given as gender, right? So gender role is what boys and girls do, right? Not what we have between our legs, but it's the role boys and girls are supposed to play. So 14, gender role socialization occurs in most cultures. It includes the development of role stereotypes, which may be rigid or fixed. Imitation and idealization with the same sex facilitates the learning of gender roles. Gender role socialization is what? Don't answer yet, please. It's a mouthful of question, right? Oh my God, what the heck are they asking me? When you're at the test, don't go to the answers until you understand what it's asking me.
Okay.
That means I have to ask myself 5, 6, 7, 8 times what they're asking me, because if I don't understand what they're asking me, I'm not going to get it right. Okay, and this is not a guessing test. I said that to you before, right? Okay, so then gender roles, like I said, this is asking me how I learn my gender roles. Gender role socialization means how did I learn what girls do and what boys do? Okay, which is true. It's primarily based on heredity. seldom occurs within families, becomes a basic component of our self-concept, is usually complete by the age of 6. Okay. Gender role association. Okay. Heredity means it's genetic. Did you inherit what boys and girls are supposed to do? Were you born with that? No.
No.
Okay.
No.
Seldom based on family. No.
No.
Right? The daddy said boys don't wear mommy's heels. Right? That's right. That's family. C, they becomes a basic component of our self-concept. Let's keep that in. And D is usually completed by the age of 6. So this is a recall. It's not C, Diana. It's not. I'm sorry. Yes, it is C. Gosh darn, it is C. I'm sorry. Yes, because D is.
Oh, you almost had me at a heart attack.
I'm so sorry. It is C, because D is not true. It happens by the age of 3.
3.
Right. I know what boys and girls do by the age of 3. Right. I've learned. I've seen on TV. I've seen mom and daddies like boys don't cry. Right. Boys don't play with dollies. That's gender role, and I've learned that by the age of 3. Okay.
Dr. Pam, can we please go back to 13? Because I'm confused about why is it A, because I thought that the civil rights movement helped to influence multiculturalism, which then had an effect on
What? Where do you see that in the question?
Because it says historically.
Where do you see multiculturalism?
Because that came out of the civil rights movement, just like testing
Where
came out.
Where do you see that in the question?
Because it says the testing movement.
Okay. So.
And then it says historically. So I was like, okay, well, historically, which ones?
I'm sorry, you were thinking? It does not say anything about multiculturalism, does it?
But that's
similar to the question that I had. So
it doesn't say where does
it doesn't say it.
It doesn't say it. Does that make sense? Okay. And Abrina, I'm not trying to I don't want to like say you're wrong. I just want to teach you how to not think. So you're absolutely right of what you said. You're right. But the question doesn't ask me that. So if you ask about multiculturalism, right? Or what is the change? It doesn't say that. It says testing movement. Right?
Okay. So which movement is connected to compulsory
testing? Okay. Compulsory attendance, because after World War I, kids had to go to school. Before that, you remember you could quit at like 14, 16. So when kids had to go to school, then that's what happened. And I'm going to be very blunt. Okay. This is based on white upper class men, written by white upper class men. The testing influence had nothing to do with people of culture. Piaget, one of the theories about Piaget is he wrote his theory on little white kids. Okay. And I don't, I'm not trying to be offended. Well, he did on his own kids. But in general, it wasn't written for people, women or people of color.
Right.
You weren't in existence. Sorry. Okay. So not at all. And that's a debate that we can have personally. And my goal is to help you pass the test.
Okay.
So,
thank you.
Abrina, I'm going to ask you a question, okay? So there was one test. First of all of our testing has bias, right? It does. That's internal. That's bias. It's written in. That's a fact. We don't dispute that. But there was one test written in the 70s that was written for Black inner city people, culture. Do you know what that was called? Anybody?
No.
Yes, ma'am. The BITCH.
The bitches! Yes! I'm not making it up. I swear, okay?
Where can I find this out?
You should have learned it in school. I'm sorry, but...
Wow.
It's the Black aptitude test, right?
Yes,
Black intelligence
it
test.
is. Yes, it is.
Wow.
Yes, it is. So what it looked at, let me see if I'll pull it up. No, we're not going to picture you. I'm going to make it.
I'm gonna look it up.
I know. Okay. So what it was written, I think his name was Robert Williams. It was written, Robert Williams in 1972. That was in Rosenthal. Oh, look at you, Kevin. Thank you. Thank you. But you
And
really
it was in good times too.
Who says TV can't teach you things? Okay.
Right.
So, but do know that there was one. Okay. It was written by Robert Williams in 1972. It was written with what his suggestion is that the test did not, the vocabulary that inner city Black people used was not the same. And if we wanted to test intelligence, then it should be based on what inner city Black people use, right?
Wow.
So that terminology, alley apple, black drop, blood, boogie juice, boot, all of those things, okay? So that is the one test that was written by Robert Williams. Okay, so you should know that just because it's fun for history, but it won't be a test question. It won't be.
Oh.
Okay, sorry. Okay, so let's go back and pick up some other questions. Did I lose me? No, sorry, 116. In a behavioral group context, which of the following are key terms? Okay, behavior. Kevin, no audio. You don't hear me? What do you mean?
Mine is messed up. I can't get you either. I'm just listening.
You can't see me? You can't
No,
hear me?
I can only hear and I can't see.
I can hear you and I can see you, but I had to change it to my phone because I didn't have enough bandwidth on my internet.
Okay, so if you can't on Zoom, you really should get me. Just give it time. I'm sorry, Laterica, is that a glass of wine?
No.
You liar. I'm sorry.
I can show you.
I'm joking. I'm joking. Okay, I'm joking.
It's actually apple cider.
I am so joking. I don't care what you're drinking. Okay. The rule is though, if you bring it to class, you have to bring enough for everybody. Did your teacher teach you that? Okay. Let's get this wrapped up, guys. So 16, behavioral context, which of the following are key terms? So D, catharsis and ego integrity. Catharsis is a Freudian term. It's an emotional release. You'll also see that term in Yalom. Yalom talked about the Yalom's curative factors in group, right? He talked about that. So it's an emotional release. Ego integrity, that's an Erickson term. Value judgment and positive addiction, neither one of those belong to anybody. Here and now belongs to what theorist? Yes! His name is Fritz Perls. Fritz Perls.
Right.
Here and now. He said, get rid of the unfinished business. That's the empty chair technique. Your mama sitting in that chair, right? Get rid of that. So then self-monitoring and contracts, those are behavioral terms. Behaviorists don't care what you think or feel. We're going to get you a contract. You're going to sign this and you're going to change your behavior. Okay. Are you talking to me? I'm thinking not. Okay, just mute yourself. 17, again, interesting question. Individuals come to counseling for a variety of reasons. The immediate goal is, it is C, it is self-disclosure. We can pretend we want self-understanding and that may come later, but people come because, girl, I got to tell you something I can't tell anybody else. Oh my gosh, do you know what I did? I can't tell any. That's why people come to therapy, okay? And the goal, of course, is that I'll get some self-understanding. But the reason you show up is because of self-disclosure. I got to tell somebody something I can't tell anybody else. Okay? 18, code of ethics question. Hold on, figure out where. I'm sorry. 1 second, guys. Go ahead and look at 18. Well, I won't. Just go ahead and look at that one. Okay. Last question as I got to go. Okay. So 18, a counselor performs premarital counseling in conjunction with a church whose pastor refers couples to her. Ordinarily, the couple sees the couple together twice, 2 times individually, and twice together again for a total of 7 sessions. In the second individual session with Tom, the counselor learns that he has not broken off the affair with another woman who is not his prospective marriage partner. An appropriate counselor response would be
B.
I already told them last question.
B.
Which one? C. No, never, never, never. C is never going to be right. You are the best counselor ever. You never refer out. Hold on, let me just finish that. If it says it's out of your scope, then you're going to seek supervision, right? But you are the best counselor. So C is never going to be the right question. And just get that, okay? So then, D is not right either because the question says he only gets 2. And in his second session, he tells me this. So D is not right either. It's a reading test. My answer comes in those 4 lines. It can't be C or D. So now I'm down to A or B. Can I do A? No. Code of ethics says I can't share the secret or keep the secret. It can't be A. B is the right answer.
Refer out.
Okay, B, not refer. No, remind Tom of the agreement.
Remind
I cannot
him.
refer.
B
B as in boy is the best answer. Okay, that's a code of ethics question. So when you're taking the test and you don't realize why I'm missing code of ethics, that's exactly what that is. Okay, I do have to go, guys. I've got plans for the evening. Go ahead.
Dr. Pam, this is Pam. I couldn't see, so I'm going to send an email so I can get the rest of the information.
Okay, I do apologize for not seeing. It's usually most often your internet because I got really great internet. I live in Gig City. We're known for internet. Just saying. But this test is actually on my Facebook page. If you go to my Facebook under files, you'll actually see this test. It's an old test, so I don't use a lot of it because it's an older test. It talked about the DSM-4. But the other questions are still very much, but this is actually on my Facebook page. You can download it for no extra. You will get a practice test. You'll get the Hellwig book. You'll get everything that I use today. Okay. Any questions? Any one question I can wrap up for you, or I can make this easier?
I have one real quick question. On your webpage, you talk about the small group.
Yes.
How does that actually work?
That's a Prudence question. Ask her.
Oh, okay.
Okay. All I do is
to make sure the email is Dr. Pam
2020@gmail.com.
Gotcha.
Okay. drpam2020@gmail.com. drpam, one word, 2020@gmail. And Prudence is my director of operations. She does the scheduling, the billing. She answers all the questions. All I do is teach.
All right. Thank you so much.
I'm sorry. You said you were out.
Oh, Amber, what's your question?
I wanted to.
I emailed the thing. It said you were out of the office. Is that something that happens?
That is correct because Prudence, she's married and she wants to spend the weekend with her husband. I don't know what her problem is, but it'll go out. Yes, there is a weekend. She does not work weekends, but it'll go out before Monday. Okay.
Now I can see you, Dr. Pam.
Okay, hold on. That was Amber. Pamela?
Yeah, right here. I can see you now. I came back on.
Girl, Okay.
But I want you to know that I got the green book, the Mastering the National Counselor Examination and Counseling Preparations. Is this the book you were talking about?
Nope.
Oh, okay.
But there's too much information in that book, but I do like all 4 tests in the back. There's 2 CPC and 2 NCE. I like the test, but that, like the purple book, has too much information. You do not need all that to pass the test.
Okay.
Okay.
Thank you.
Carla.
Yes, thank you. That
you.
was helpful. You mentioned testprep.com.
I'm going to tell you that I've got a fine looking black man sitting
need to
right
go.
there. So you know what? And if you've seen my videos, I've got some bias. I like fine black men.
I appreciate that.
Okay,
I've been watching your shorts. Are you putting more shorts up?
I'm going to try to.
Yes.
I will. I work like 27 hours a week, a day.
Understand.
Okay, but I will. Okay.
Enjoy
Can I
your
go?
dinner.
Can I go?
Enjoy.
Can I go?
Enjoy.
Can I go?
Yes,
Bye.
enjoy.
It's been fun.
Thank
Thank you
you.
very much, guys.
Bye.
To get in tomorrow's class.